Transmission has started. Joseph, transmission has started. Sir, I'll give, sir. So this is I just like to welcome you all for this inauguration for this CME ceremony. Yes, sir. Uh, so this is our center, Kamala Sundaram Eye Center. We are pledging to cater the needful people of the society. So we can see the reception area of us where we do diligent checkup and registration of the patient. This is our OT setup on the left hand side, and this is our complex. We have 3 OPD setup over here for catering large number of patients. The second setup is dedicated for ophthalmic purpose and for consultants. As we enter in the OPD room, we can see it's a dedicated ophthalmic setup for OPD structure. We have the best in the market instruments and everything so that we can cater the patients as good as possible. On the left hand side, we can see our OT setup. And this is our pharmacy area. We are moving ahead towards our admin area. Here, the optometrist do the vision checkup and also the admin works will be done. This is the checkup area for preoperative anesthesia checkup and for physical fitness. We usually check up in these rooms. We have our inbuilt pathology lab within our setup to ease for the surgical management. So we welcome you all for this journey for eliminating blindness to make the India blind free. Thank you. So I will be presenting here my journey from Arvind to KSF, 2D life aiming for 3D future. I just want to share my journey from Arvind over here over past 5 years. So hi, I am Dr. Avik Desarkar. I am senior consultant and vitreoretinal surgeon in Kamala Sundaram Eye Center. I have done my MBBS from Nilratan Sarkar Medical College and MS degree from Midnapur Medical College. I have finished my long-term vitreoretinal fellowship in Arvind Eye Hospital, Madurai. So these are my few like early days in Arvind. This I think the photo in the right side was the first day when I reached Arvind. It was a very early morning. We used to have a very we used to start very early in the morning, like 5:36. We used to go to our clinics. By 6:30, the footfall used to start, And this the photo in middle is my introduction period to the Arvind and to Oro Lab. This is a photo of our diabetic retinopathy screening camp. So it was a simple but useful screening camps for diagnosing diabetic retinopathy and all other retinal vascular diseases. Arvind used to do both the cataract and diabetic retinopathy screening camps, where more than 250 plus diabetic patients used to be catered, and over the period of years, 7,000 patients used to be catered. This used to help in discovering population for with unknown diabetic retinopathy related changes and complication, and providing early treatment for the same, because many of the patients never used to come to the hospital. It was from a very outreach areas. So you used to go over those areas. It used to be 100, 200 kilometers away from our base hospital, and we used to cater to those population. So what are the biggest life lessons I have learned in Arvind? First is it's more than the medications. It's your empathy that heals the patients better. A kind gesture, few words of sympathy, and an affectionate care serves more to the patients. It is not always the biggest of the medications or biggest of the surgeries always heal the patient. It's more how you treat them, how you see them, how you feel for them. But at the same time, it's an organizational values and structural robustness that makes you self-sufficient and more productive in catering to the mass population of the society. Simple, stepwise procedures help in making a giant empire of healthcare that can serve millions. Also, to set a goal in achieving perfection, one should be very clear regarding his goals and passions. The more you nurture your area of interest, the more you become confident and competent. So, never to stop learning unless you have learned it well. We used to we used to discuss over there over different cases, different intriguing facts, everything. We used to deal with retina all day long. This was my degrees that I have received over there. But does learning stop over there? Definitely no. So we used to go for publications, publishing in the best of the journals. Some of them are definitely very close to my heart because we have given a lot of time, lot of research for all these publications. And finally, I got an international recognition in ASRS conference in Stockholm, Sweden, couple of years back. In the recent accolades, I have received the appreciation certificate for one of my articles from IJO, and I have been awarded as the distinguished contributor for JVRD publication from American Society of Retinal Surgeons. But still, I genuinely believe my happy place is my operating room, where I used to spend most of my time over there, and I would love to spend the same over here also to cater most of the patients. I just want to show a couple of my surgical videos in short. So this was a GRT RRD patient. It was a complex surgery because already the patient developed PVRC changes, so, and we can all see that we can see very well over here. The retina is crumpled even in the middle of the posterior pole. So wherever it was almost a complete bare choroid. So we started nudging all the pre-retinal membranes all over the retina. And on the posterior pole, we have tried settling with a PFCL bubble. Although I have not given a large PFCL bubble because it was going through the choroidal region subretinally. So initially I did not want to give a large PFCL bubble. So we started managing the PVR membranes. We can see the pre-retinal membrane is coming in toto. As I have removed the preretinal membrane, so I have given a little larger PFCL bubble. And with the help of the Thanos DDMS forceps, I was trying to flatten the retina, which has been already crumpled over that region temporally. With after BBG staining, we started doing ILMP. And I genuinely believe all the PVR cases, it is better to do an ILM peeling, because we have seen in our most of our cases that if PVRC and all those things happen, usually those patients are tend to form ERM in a very recent soon course. So it is better to do the ILMP on the first go only. We usually do not do it on the second time or anything. We usually do it in the first go only. And we usually prefer it doing under PFCL. After ILM peeling and thorough base shaving, we have started the fluid air exchange. We can see the bare choroid area temporally. That much of retinal shortening was already there. And finally, after settling the retina, the case was closed under silicone oil. This is another case of macular hole with RRD. In the same way, we can see the PVD has been induced. In many of these cases, actually, the regular PVD induction is little difficult because of anomalous PVD and all. The PVD is the last sheet of vitreous is usually quite adherent, so it is better to go for forceps. Sometimes we use Thanos also. For it depends on the ease of the surgery, whichever instrument we are particularly using, whether it helps or not. So after removing the vitreous membranes, we are trying to settle the posterior pole with PFCL, and we can still see that in the periphery, in the mid periphery, the vitreous membranes are still over there. If we don't address those vitreous membranes, it will just keep on causing more PVRC in the post-op period. And we used to believe over there, a person who knows to manage one hole can manage even more than one holes. So we never used to be afraid of making a single one or two extra holes iatrogenic maybe. But we always used to believe that the PVRC changes all the preretinal membranes and the vitreous should be dealt very well, because those are the reason why again the PVRC, because of the PVRC re-RD happens. And here we have given we are stained with blue, and the macular hole area we are covering with inverted ILM flap. Usually for all these cases, we like to do arcade to arcade peeling as large as possible. But for normal macular holes, as a routine procedure, we used to follow that at least 2.5 size of the hole size. That area of ILMP should be done around the hole. And if the hole size, we used to do beyond 600 micron, if the hole size is, we used to do inverted ILM flap. So after after apposition of the flap, we have done the laser and the case is closed under silicone oil. He was my first international fellow, did ROP training under me. He was Dr. Ahmed. He was from Tanzania. He would have been like now he is practicing ROP over there. He's the first ROP surgeon and ROP specialist from Tanzania. He's been trained in Arvind. So it was a little pride moment for all of us that we have actually led a country start ROP management over there. Then why shifting to Kamala Sundaram Eye Center? So the values and the ideas Arvind has taught me over the years, it was time that I should apply to another population where it is needed. In such a big metropolitan city like Mumbai, where businessmen to film stars rule the society, a large part of people still can't afford adequate healthcare. Here, under the able leadership of Dr. Natarajan sir, I felt I can achieve the dream I have seen all throughout eye care service for all. His Blind Free India movement resembles very closely to the lessons we have learned in Arvind, Dr. Venkat Shami sir's mission of needless blindness. I have performed a surgery over here. This is a simple CRVO VH surgery, but we can understand. This talk is more about of SeeLuma. This surgery we have done it over here under SeeLuma guidance. The machine is brilliant. We can understand the clarity of the recording and everything, and the same picture we could have seen inside also. It was actually very helpful doing the surgery. So it was a simple vitreous hemorrhage case in a CRVO. Already all the vessels were seen sclerosed intraoperatively. We can see the sclerosed vessel over the temporal arcade. So a thorough vitrectomy has been done, not only to clear the posterior pole, but also to clear the as periphery as possible in order to decrease the PVR changes as well as to decrease the chances of NVI in future. As we can see, there is a large clot or chunk of blood on the posterior pole. So over there, what we used to do is we used to use a 1 cc cannula. The same trick I use over here also. We used to take a 1 cc cannula and we used to fill it up with saline for half cc, and we used to do a gentle jet over the posterior pole, over the bleed. So it actually helps in clearing the vitreous hemorrhage over the posterior pole. The jet should be controlled so that uh, it should not hamper the macular anatomy and integrity, but it should be again little forceful enough so that it dislodges the clot. With practice and precision, this becomes very easy. So we can see over here the clot has been dislodged from the posterior pole. So just for and I as a institutional teaching, I always use tricot in all my cases. Just for the sake, we have seen a lot of cases where we have thought that the PVD is already induced. It's a brilliant case, but after giving the tricot, we have realized there is a second membrane or there is an anomalous PVD lying over there. So we as a institutional teaching, I always use tricot. And under PFCL, usually for CRVO cases, I usually do ILM peeling under PFCL because I genuinely believe the inner retinal part is usually very thinned out in all these retinal vascular occlusion cases. So while doing the ILMP, it becomes the retina appears very friable. So I usually use PFCL. So after the thorough
planapod or through a different approach. Any associated ocular abnormalities also should be ruled out. So IOABs are generally frequently enter the eye through the cornea 65% of the time. They enter through the sclera 25% of the time and through the limbus 10% of the time. And they are frequently lodged in the vitreous cavity most of the time around 61%, but can also be seen in the anterior chamber near the retina or near the lens, or it can even go subretinal. So there are different methods of IOFB removal. One of them, especially for the metallic foreign bodies, is by using a magnet. So there are different kinds of magnets which can be used. The first one being a Boston external electromagnets, which is a bigger in size, and the second one, the below one, is intraocular rare earth magnets. There are different kinds of forceps which are available for IOFB removal. The complications of IOFB or any trauma could be endophthalmitis, retinal detachment with proliferative vitreoretinopathy. There could be metallosis, especially in cases of iron foreign bodies or copper foreign bodies. It can induce siderosis or chalcosis respectively. There could be subretinal neovascularization. So there are different papers which have been published which suggest that IOFBs, it is important to consider all the open globe injuries to have an IOFB until and unless proven otherwise. So whenever any open globe injuries come, we send them for some radiological investigation. And there are other publications which suggest that delay in IOFB extraction or presence of intraocular hemorrhage, preoperative retinal detachment, primary surgical repair combined with IOFB removal are the predictive factors for anatomical failure. Another thing is this OTS score, especially for our PGs. We show them that initially whenever the patient comes to you, according to his vision at the time of presentation, suppose he has a no PL vision, then his raw score is 60. If he has a vision of PL or hand movements close to face, then he has a vision, raw points of 70. More than that, then the raw points increases. And the other factors, like suppose it is associated with a globe rupture or endophthalmitis or a perforating injury, or it may be associated with retinal detachment. So the points get subtracted from the initial raw points, and whatever the final outcome or final raw points are there, depending on that, you can give the patients assurance. Like the patients, basically these trauma cases are very young patients, and they are very much like anxious about their final visual acuity or visual prognosis. So they come to us whenever they are coming for the follow-up that when will my vision return back. So for such patients, you can give some assurance that by the end of this 3 months or by the end of this thing, your vision will be this much. So this is just for the theoretical point of view, but then this is good for them to give some assurance. So the take-home message would be managing ophthalmic trauma is challenging. Clinical and surgical skills and equipment vary from place to place and country to country. The management of serious eye injury requires a variety of alternative strategies. In general, if a healthcare worker can diagnose and treat a condition and recognize the complication, then he or she should manage the case. Thank you so much.
Thank you for the wonderful insights, Dr. Shruti. Now will we... Okay. So now it's time for the discussion.
It's good. Yeah. It was an excellent presentation, ma'am. All the cases were very...
Thank you.
The last case, a similar case we have also seen over there. We used to tell it Burj Al Khalifa in eye. It was
Yeah,
such a large...
actually.
it was such a large...
Not expected.
Yeah,
Through such
yeah.
a small corneal tear.
Yeah, exactly. Most of the times it goes end on, so it
Yeah.
has a very small tear, but inside it is a
Inside
very...
it might
and those
be
cases are
damaging,
extremely
yeah.
challenging to tackle with, because we have to make a... While
Yeah.
taking it out, it doesn't come through the normal, natural way.
Right.
So it is
We had
becomes
to
very
literally
difficult.
struggle.
Yeah, it was a very nice case, and the previous
you.
cases also, those are also very challenging. Especially the first picture you have shown, it was a very dreaded picture, but it was a very nice presentation, ma'am.
Thank you, sir.
Thank you. Thank you. It is a nice. We have also done recently. We'll be publishing one paper on last 4.5 years over there. We have done some 102 cases. We have taken of IUFB posterior pole only. So we'll be publishing it very soon. And we are also in the same line. The way you have told, the same way only. We usually do it as soon as possible. Within 24 hours is cut off for us also. As soon as we get the patient, if we are diagnosed with IOFB inside, we are sure with it, we definitely go for as soon as possible. Sometimes we take it on if the patient is coming with an open tear with IOFB, sometimes based on the integrity of the wound, we have to take a call whether we want to do it in a single sitting or we want to do it in another sitting, second sitting, because many other times the corneal wound is so bad. Usually if it is a scleral wound, we usually try to do it in the same way, and we usually try to take out that metal, whatever foreign body is there, through that particular wound, not to make another wound, just for the sake of the reason that another wound will take a longer time to heal. Better, anyway we will be sealing it off, we will do it. But for corneal wounds, the same way you do, like we usually make another tunnel and we do take it out through that only. It's the same procedure, same.
So one more question, like suppose if the foreign body is very posterior, then have you taken posterior pole? So have you taken it through a scleral route, like instead of taking it in the front? And especially when it is not a metallic foreign body.
Yes. The thing are, I can remember 2 or 3 of our cases. First is one case like it was diagnosed little late. 2-3 days later, and it was just on the optic head disc. So in that case, we actually left it behind. We actually, because we are not going to give anything.
Which kind of foreign body?
It was a glass foreign body.
So it was an inert foreign body.
Inert foreign body. We also understood it's an inert foreign body. The moment we will take it out, actually there was a hematoma forming over it. So it is better to be left it inside like that. And rest of the things, if it is not a metallic foreign body over the posterior pole, usually we prefer a scleral route. So that we can, because what we have actually the metal intraocular magnet we use over there, we used to tell it is from Namsar sage. We use it for my teacher, Dr. Naresh sir, he also have seen in his residency period that same intraocular foreign body magnet we are using. So the only thing he always used to tell us that placing the intraocular magnet is a very important thing. Is the most important thing, because as soon as we will touch that magnet will get started, the foreign body, if it is metal, it will immediately come get into that. So if it is not aligned properly, not aligned in the right direction,
then it might cause damage.
Any tissue it can damage because it will come straight up.
So basically aligning the magnet inside the eye is also
it's a very
you should align it according to the intraocular foreign body.
Exactly.
In that line.
Based on the posterior, usually if it is posterior pole, we usually judge that exactly at what position it is. Rather, it used to be more challenging. We had a case of pars plana foreign body, where we were not able to find. We were able to see the foreign body on the CT scan, but we are not able to localize inside it. And it was just outside the pars plana. Like the only one point is within the pars plana, one tip, and the rest of the things are actually behind the eye. So it was a very difficult case.
Recently, we also came across one such case last week only. We had a CT scan, it was an open globe injury, and we had a CT scan. We could see the foreign body, metallic foreign body, and I went inside and I could not find any foreign body. But I could see a point where there was a retinal tear, and I could see a bleeding around that. So I understood that there was a foreign body. I tried to search for it, but I could not see anything.
Sometimes
then finally I had to close the case.
It happens. For us also it has happened. It has happened. Once we got it behind
then we saw the CT scan, radiological scans in a video frame, and then we found out that it was actually in the orbit. So it had penetrated the sclera and it had gone into the
orbital. That also happens. So we have also seen those cases where we have thought like it is inside the eye, but it has already had a penetrating.
But then it was good decision that we went ahead with the vitrectomy, because we had to laser that spot.
Definitely. That our over there also same learning that if a foreign body is there, if we are knowing it, it's better to be intervened as soon as possible, because we don't know which one But I have seen cases where patients are presented even after 6 months. The foreign body is as it is. It
As
has
it
not caused any problem.
Any
The
problem.
patient
Yeah, I know.
over there, many a patient used to come from Middle East. So
Okay.
they used to work over there. They have told nothing to be done. Over there, cost of medication is so
It's
much.
high.
So they have not done anything. 6 months later, when they
Oh.
have come to India, they have okay, we'll go and check into.
Luckily, they are
Arvind, and
fortunate that they
that
have-
time we are
nothing has
fine.
happened.
Yeah, and 6 months, it's nothing has happened. But at the same time, we have seen cases where within 12 hours we have lost.
I know,
the eye.
I know.
It is
There are
very
cases
bad
of
case.
endophthalmitis
Yeah.
in
So
within
endophthalmitis,
12 hours also.
So it is better not to, because we have had a case like we had a secondary center in Dindigal. It's like 60 kilometers from our
Okay.
place. Over there, the patient presented with 6/9. By 12 hours, the patient has come PL negative.
Oh,
We couldn't
that's
save the eye. So that also has happened.
I know.
Obviously, it's a very challenging and very tricky situation
know,
for
trauma
every.
is like-
And you don't know. You cannot
Yeah,
predict.
you
For,
cannot predict. It's unpredictable.
Yeah. For the rest of the cases, we actually go with a pretty notion way.
Yeah.
Okay, it's a VH case. Oh, okay, it's an MTRD case. I will see the OCT. I will do like this. And I will segment it. I'll delaminate it. All those things. But for
Here you
trauma
cannot
cases,
plan
we
this.
cannot plan anything. We don't know what is
Yeah,
inside,
what is it
how
inside.
it would react
Yeah.
inside. So it was a nice presentation.
Thank you,
ma'am.
sir.
Thank you.
Thank you, sir.
Thank you, Mayor Avik, and thank you, Dr. Shruti, and also thank you, Sandeep, for the introduction. So now I have a pleasant duty of inviting Mr. Dakshinamurthy, the national head of Bausch and Lomb India, and we are happy to work with Bausch and Lomb because I love the anything new, and I keep trying new things, and he will be talking about the new what is SeeLuma. Thank you.
Thank you, sir. Good morning, everyone. So I would like to take this opportunity to thank Professor Dr. S. Natarajan, the world-renowned surgeon, and then the amazing personality, and then the person who attracts everyone and group them with lot of fun and then enjoyment, along with the, of course, the scientific as well. So it's a great honor to get associated with our innovative and then the latest digital visualization, which is a 3D visualization. It's a kind of a game changer in the industry, so which introduced by Bausch and Lomb. So we are really excited to associate along with Professor Dr. S. Natarajan with Kamala Sundaram Foundation and Shanmukhpriya Healthcare Center. So Bausch and Lomb, as many of you know about Bausch and Lomb is a very high image brand in across the globe. So it is a very high reach of the brand of Bausch and Lomb across the world. So since 1853, the company started with a lot of vision, and then the mission to accomplish still going on as on today. So the company, as an overview, see, it represents in almost like 100 plus countries, having a product range of like 400 plus products, including contact lens and surgical products are there, of course, and the pharmaceutical as well. So having an employee of about like 13,000 employees across the globe. So the mission and vision of the Bausch and Lomb as a company is like, the mission is to provide the vision for the people across the globe, and the mission, with the mission of providing the vision across the globe to each and every people, and it implies, or it has the innovation and the quality and the craftsmanship of the products, so which rooted to pursue the quality of the vision and enhance the vision through the each phase of the life. So that's the vision and the mission of the Bausch and Lomb, which taken care. So now Yeah. So I will take you through the product, which is the unique one, the 3D digital visualization, which is first in the industry as a game changer, which has been launched by Bausch and Lomb. So there is a short video. This is the SeeLuma unit. 3D digital binoculars. This is the first in the industry. Digital binoculars. And heads-up surgery. This is the first in the industry having a heads-up surgery. Though there are different technologies available, this is the first in the industry along with the digital binoculars. Digital binocular also comes with the 3D. So these are some key features I will cover. You can notice here these are some of the key features which having the, I will point out some important one, which is the digital binocular is the first in the industry which we provide from Bausch and Lomb. And it has two monitors, one is mounted over here on the system and one is coming with the standalone stand with the 55-inch monitor which is available. And this is the camera unit. There is no optics involved in this digital visualization. It is purely on the camera, 4K camera, and then it is projected on the screen, directly over the screen over here. That's a 3D or the 2D images transformed to see and then to operate by the surgeon during the procedures. I will take you through in a detailed way for the features. So SeeLuma, it includes the two cameras are present. The 4K cameras are present over here. It has the motorized zoom and focus range is like 90 mm, which is the largest or the longest one, which is available. Working distance is as usual like any microscope, the 200 mm or 150 mm, which is available. And the red reflex illumination and then surrounding field illumination. The other beauty in this system is like it is a digital illumination which is available. So it is not through the bulb or the light alone to be monitored or to control the illumination. It is the digital control is available in this system. And keratoscope is available and digital filtration also it's possible in this system. It has a comprehensive features to provide the solution and to make ease for the surgeon to perform and to deliver the quality of the each and every procedure, to reproduce the outcome for as a 100% quality outcome for each procedure. So this is the C-shaped arm. So this digital visualization has been developed in consideration of providing the support to the surgeon, meaning that the health of the surgeon is taken as a first priority. So heads-up surgery this is a real heads-up surgery. So the surgeon can watch here, you can notice it's like a heads-up, C-arm is there. So just heads up and straight and then they can operate. There is no need for an angulation over here. So this is the 55-inch monitor in front of the surgeon which is available. This is a 3D video. And this is how the position of the surgeon will be there. So we have taken care of the surgeon position for each and every procedure. So there is another screen which is available, 31-inch monitor which is mounted over the system itself also available, which gives more convenient to operate for both the eyes at the same time without any change in the OR. So this is the digital binocular which features with the 3D imaging also with this digital binocular. So some surgeons or most of some different cases they want to use the binocular. This option is still available. Though it is not through the microscope, the view, but it's a digital imaging which is available from the camera to the digital binocular. And this is another unique feature which is available in our system. It's a motorized glaucoma adaptive technology which is available. So the microscope image can be tilted with the tilting the image of the camera itself. There is no surgeon to tilt and then operate or to bend and operate during the procedure. So this is a unique one which has the indicators also is available. The surgeon can monitor and then notice where to align the focus, and then the zoom range also can be checked, and also the orientation of the eye position as well. And this another key feature which is digital staining is possible. So during the procedure the staining can be done with the digital performance. the arrangement of the digital from the system itself can be done. So this is the customization of the digital can be arranged. So the surgeon can program the customization of the color or the digitalization, the staining. So this is the unique one which is available as an assist mode in the system. So where the senior surgeon can guide and then teach the juniors, and then the newcomers or the new residents can be taught with this. So you can notice there is a marking over here during the image can be done. This on the overlay it appears, and the surgeon who is performing can having the direction, and then they can perform. So it can show all the directions like marking and everything can be done during the live surgery. And this is the adaptive contrast enhancement which is incorporated in our platform. So you can notice here this is without contrast and this is with contrast. So you can see the difference very clearly here. So which can be set, and then during the procedure which it can be utilized. And this image quality in the zoom, different zooms. This is the minimum zoom which is like a normal condition 0 and 50%. There is no compromise on the quality of the image and the illumination also. You can notice the focus also it's perfect with this platform. And higher magnification, same depth of field, same resolution without any light loss. So this is the quality of the image, one short procedure. You can notice the red reflex. So this system is, though it is dedicated and then to be utilized for the retina, vitreoretina, but it is a comprehensive system, can be used for cataract, corneal procedures, and even corneal transplants can be done, and also the glaucoma procedure, and of course the retina is available. So it's a solution for everything. So in our country like India, the cataract volumes are so high. So the surgeons operating like 10, 20 or 30 or 40 cataracts in a day. So you can imagine the surgeon sitting and then bending their neck and then operating. So now this technology or this solution is available where surgeons can sit straight and then operate. So only to maneuver with the hands and then they can operate to focus on the quality of the procedure. So you can notice here the surgeon is sitting straight and then operating over here with the 3D glass is there, and then it's like a heads up and then operating by the surgeon. I think there is. It is playing from the cloud, so it is not picking up the video. Yeah, this on the retina procedures. You can see the image quality over here. Sorry, the video could not continuously to play because it's from the cloud it is playing. So there is an option in the system to have a 2D and 3D option is available. Even the recording can be performed in the system with the 2D and then 3D image as well. So that's all on the feature of the SeeLuma. So once again, I would like to thank Professor Dr. S. Natarajan. So thanks for this opportunity, and then we are looking forward to have more excitement with this new technology. And then he performed this technology, or he used this technology much before of many of our company people. So he already had an hands-on and then teaching to many surgeons across the globe. So thank you, sir. Thank you very much.
Thank you,
Thank you,
sir. And we have Dr. Shruti, so we have to have, you can ask some questions to him. She is a professor in Sion Medical College.
Yeah.
Now
Hello,
I
doctor.
am an emeritus professor there.
Yes, doctor.
I hope one day we can buy that.
Hello, sir. So nice technology. It will be helpful for the surgeons
Yes,
who have been operating on CAM patients, who have been operating for many patients in a day.
Correct.
Really nice. So how much is the cost of this?
We will discuss, doctor. Cost. I think sir knows the cost actually, but we will discuss it.
We can also plan, we can also think about bringing this into BMC
That's it.
hospitals.
Yeah.
You ask Samir, इसको बात करो. Talk to her.
So sir, even the anterior segment surgeries and retinal surgeries, all
Yes,
the surgeries can
yes,
be performed
yes,
through this.
yes. All possible. And there is one more addition is going to come in the near future, which will have intraoperative OCT also will be available.
Okay, yeah,
IOCT
yeah.
will be available.
Yeah. Okay,
And
that
this
will
is
be
an
great.
official project by Bausch and Lomb with Heidelberg Engineering. So it's a direct project, which is a corporate arrangement. So,
Okay.
but Bausch and Lomb will be available for the sales support and then commercializing in the market actually.
Okay.
Yeah.
Is it a huge setup which we need for this? It will be a space.
There
How
is no
much
major
space?
change in the OR actually. There won't
Okay.
be major change, but still we need to have a site inspection before getting this system. Even mobilizing this system also, it has some unique dimensions.
Okay.
So that's the requirement actually. Otherwise, it's like in the regular in the OR,
Regular.
the movement. Actually.
Okay. That's good.
मेरा
Really
लड़का
nice.
इधर है यार. तुम करो यार. ये इसको दे.
Yeah, he was suggesting to.
तुम रखो.
Okay. We'll work together. Yes. Thank you.
Thank you.
Thank you, sir.
Avik has to ask some question. Avik.
Yeah.
Subramaniam sir. Subramaniam sir.
I got an opportunity to work on this machine once. It was a lovely machine. Definitely congratulations on your part. Definitely it's a very good and very new technology.
Yes.
Because
Joseph.
3D technology has been there, but again with that such clarity, with that precision is very good. Because many a times we used to previously, because previously when I used to do 3D surgeries, the color balance issue used to be there.
Correct.
That some things are very more light on the lighter side, some are more red.
Correct.
So this is that true color it was extremely appreciable. So that's how I really like that machine. Even the analog system, that is also a new system that I have never worked in.
Yeah.
So that is also a new experience. It was a lovely experience over there. Thank you for this.
Thank you.
Definitely,
Thank you for
it was a
the-
nice experience.
Thank you very much.
Shruti, we wanted to bring the SeeLuma to Aditya Jyot actually. Can you believe that it could not go in? And here we broke the OT.
Yeah.
And then we made it, luckily, because we were in the construction time, I requested the Shanmukhpriya trustee. We broke the OT and got the machine in. Otherwise, it was not going in. And Arvind and probably it will go in, I don't know.
Yeah, yeah.
They did it in military hospital.
Yeah.
And in Greece, they actually lifted in 7th floor by by crane.
Crane, yeah.
Like a high this thing, crane.
Okay, sir.
Okay, so my talk next. So thank you, Dakshinamurthy, and I am happy to be here. So I want to talk about why I am doing all this. So I am here only because my grandfather was born in 1900, and his name also happens to be Subramania Nataraja Pillai, and this happens to be the place is gifted by us by Subramania Samaj. Subramania is actually the name of Lord Muruga, and I don't know whether any of you know in Tamil Nadu, we keep everybody's name a God's name. The reason is so that you cannot scold him. So my great-grandfather was Subramaniam, and my grandfather is Natarajan, and he was an eye doctor. He became a licentiate in ophthalmology and licentiate in LMP, licensed medical practitioner, in the British time in 1920 itself. And 1930 he was in government eye hospital, where I was also there. But my father, Dr. Sundaram, he was born in 1927 in Kulasegarapatnam. Anybody knows, Avik, you worked in Arvind, Madurai. Do you know where is Kulasegarapatnam? Okay, Dakshina, you know? Now, what is the importance of Kulasegarapatnam today? When my father was born, it was not important, only for the local people. Do you know? It's going to be an international center like Sriharikota. That's going to be the ISRO's next bigger launching pad of a rocket, because the location is like that. It's a beautiful seashore, and there's a Muthumaraman temple. Avik should know, they celebrate the Kali Puja 10 days Dashara better than Bengal, and only in that town. And it is and everybody dresses up like a Kali.
That's nice to know, sir.
No, not only that. They get into, in the south, they actually think God has come. I don't know what it is, but anyway, Ramakrishna Paramahamsa also had that. Ramana Maharishi had that. And somebody has written, I forgot the name, Arun Shauri. He's written, they were all in trance and nothing to do with God. But actually it's God, according to me, because Swami Vivekananda also told Ramakrishna, show me Kali. He said, how can I show you Kali? You want to see Kali? You see. So I am waiting for that moment to be with Kali, and I think it will happen. So these are 3 generations. You can see he was a smart with a strict mustache, and I am telling strict because he was very strict. He used to clench his teeth, and you can hear it outside. And I was always afraid to meet him. And he used to, and this was his biography. He passed away in 1977. He studied in St. John's College in Tirunelveli, Palayamkottai actually, and he graduated from Tanjore, and he also worked in the various places, and then he has made, no, what is this? This is not... So my father was, as I said, born in Kulasegarapatnam. So he always had a success. He mentioned this, and success comes from hard, devoted, and dedicated work. And my father was telling about my grandfather that he worked from Kanyakumari to Orissa that time. It's Madras Presidency. He worked in Ganjam district. He worked in Andhra. He worked in Tirunelveli, Madurai, and Tanjore, everywhere. And later, in 1941, he went to Government Medical College and Government Erskine Hospital in Madurai, and where Dr. Venkatasamy was his junior. What, Avik? Dr. Venkatasamy was junior to my grandfather. My father was junior to him. My father also worked in, because of the government service, a tutor in biochemistry in Madurai Medical College when Dr. Venkatasamy was assistant professor of ophthalmology in Madurai. So he was born in 19 January 1927. And he retired as the head of the government ophthalmic hospital, where myself, like my grandfather lived in 1930s to 40, and my father came in 1955 there, and I was born in government Erskine Hospital. Now it's called Government Rajaji Hospital in Madurai, and then I lived in that compound from 1957 to 1969, and then he was a superintendent, and he has started the various clinic. The main thing he started was a genetic clinic in 1984. He started special clinic on genetics, which was the first of its kind, maybe in India itself, and under government of Tamil Nadu. He performed about 30,000 cataract surgeries and organized more than 1 million surgeries as a chief of the camp, and done refraction for 3 million people. So because he used to ask me so many questions, I hated doing refraction. So I stopped doing refraction. And so he has conducted more than 100 eye camps during his service, and then he worked under the banner of various NGO with Lions Club, Sight Trust, Kanchi Trust, and also he made his own trust. And he was very fond of educating public, so he made an eye exhibition, and this is there in the Science Center in Chennai, which is called the Periyar Science Center in Adayar. And he still is, there's a thing called NS Sundaram Eye Corner. I wish I can do that in the Science Center in Mumbai. One day I will do it. So he is fond of doing exhibitions, and he used to make me work on that, and he has done for the last 50 years that time. Now we have to start that again. And he also authored many books on cataract, glaucoma, diabetes, vision and eyeglasses, genetics, children's eyes, red eye, head eye. He actually got it published in Tamil and released by Dr. Venkateswamy, and the founder of Arvind Eye Hospital. And the last Tamil book he wrote was Kanvoli, which was released by Shivanandan in Shanmukhpriya Hall in Mumbai. And then he also wrote a book, Kan Padhukapu, in 1981, a chapter introduced in the 7th standard textbook, because he was very particular that everybody should know what is eye. And his special interest is community ophthalmology. So the whole center is named after my mother and him. So I'm happy I could dedicate this. But the community ophthalmology center here, I inaugurated on January 19th as Dr. S.S. Badrinath International Institute of Public Health Ophthalmology, and that's our dream. So this is the one which recently Elton mentioned. Vision is our mission, and I think my father mentioned in 1980s, and he was a recipient of Seva Ratna Award, Vaidya Ratna Award, Lifetime Achievement Award by Tamil Nadu Ophthalmic Ophthalmology, and then also the Dr. G. Venkateswamy Award for Community Ophthalmology in Tamil Nadu. And lastly, he served as the rector of Aditya Jyot Institute of Optometry and mentor of Aditya Jyot Foundation for Twinkling Light Lives. The place, you can see the Minister Eknath Gaikwad and his daughter MLA, what Gaikwad? MLA? MLA का नाम क्या है? एकनाथ गैकवाड़ का डॉटर का नाम क्या है? Madam? She is in Sion, madam. Sion Dharavi. What's her name? I forget her name now. I forgot her name. That's the daughter. She's a MLA now. Varsha Gaikwad. So this is the Mr. Chelladurai. So that's me, and my father is sitting there. He always insisted that I should go and give a talk to school children. I used to get bored, and I used to fight with him. What is the point in going and topic on diabetic retinopathy to them? But he used to, I realized later, then I started giving a lot of school lectures. He told me, let them understand whatever little they know. Only thing they have to know is if their father or grandfather or great-grandfather has diabetes, they should take them to eye doctor. That's all they have to know. But for that, give a lecture, he will tell. So this is next to Sion Hospital, madam. There's a school there, and which even now I go, and that's our center, which is there in Dharavi. That fellow is Chelladurai. It's called Gandhi Education Trust. That we are having that as our registered address. And that's my father and mother and 52nd wedding anniversary. So that was my rental house in 2007 when, because my mother developed paralysis of both sides, and I decided to bring her to Mumbai. So I daily made her go out in wheelchair. I had 5 people, thanks to Mahadev. Mahadev is here today. Pradeep. And can you call Mahadev or Sandeep? Can you call Joseph and Mahadev? So my Mahadev used to carry my mother and take her to the Five Garden daily. And also all my installation as a president of Bombay Ophthalmology Association, Maharashtra Ophthalmic Association, she was there. And I could not take her out, but in Mumbai we had a special car my father bought, so we should take her in the, it's like Tata Omni, I think. So now this is what I learned from my father: eyes that heal, hearts that serve, deeper purpose of eye care. And I am very glad Avik has imbibed that from Arvind Eye Hospital. He mentioned in his talk. I will replay his talk in the YouTube and see. And everybody should, young eye doctors should download his talk and probably my talk to tell the young people that we are grateful to our teachers for whatever we are. He is grateful to Dr. Naresh Babu, his teacher. I met him last week in Shankar Nethralaya. So coming to the today's topic, the main thing I want, as I said, I'm dedicating to everything to my father, mother, and Joseph. I showed my mother's picture. I wanted to thank you because Joseph looked after my father and mother continuously, and last few months, I think probably some circulation problem in the brain. So my father was irritable, so he was all the time fighting with me. So interpreter was Joseph, and he was complaining about me to him all the time. And last 4 months he lived in Chennai and died at the age of 89. No, I thanked you and Mahadev because we had 5 people carrying her daily and taking her out. So this is my oration which I gave in Vitreoretinal Society of India. I am a founder of Vitreoretinal Society of India along with Dr. Patnaik, Dr. Ursekar, Dr. Rumi Jahangir, and my membership number is N003. So this is Dr. Patnaik, and that is his wife, Kalsi. And you can see Dr. Patnaik, Dr. K.K. Mehta, Dr. Dean Elliott, Dr. Badrinath, because I was doing this International Advanced Vitreoretinal Surgery course. This was in 1999, and you can see my fellows and faculty, and you can see Dr. Rajat Agrawal, Dr. Dinesh Talwar, Cyrus Shroff, and many. And like Joseph, there is Sanjay there. I cannot forget him. He was my, and he is the chief of RP Center, Dr. Atul Kumar, Dr. Sunil Parekh is here. He was a versatile surgeon. And I think the reason is we are teaching from the year 90 and from 1984, because I started doing vitreoretinal surgery from 1984. And this girl Gayatri she's an optometrist, and she's married a guy who was supplying intraocular lens to us, and now she's divorced. And she's in Chennai, and then you can see Dr. Daljit Singh. He was my fan, and to my left is Dr. So anybody knows? Avik, you know who's to my left?
This is Harry.
Correct. Sohan Singh Hare, the authority on optic nerve. And Daljit Singh was my fan. He used to come to my OT and teach me, not teach me, to give me ideas how to remove foreign body. He was a cataract surgeon. I assisted him in 1982 for his intraocular lens as a postgraduate. And I decided to go to Amritsar to learn. That time nobody was doing intraocular lens, including K.K. Mehta. And I was a postgraduate, and now in Government Ophthalmology Hospital, even doing a cataract surgery was a problem. But I still did 500 cataract surgery as a intracapsular cataract surgery as a postgraduate. And I thought I should learn steel sutures and an iris claw lens from him. And unfortunately, Operation Blue Star happened, and I could not go to Amritsar. Then I joined Dr. Badrinath, and that's Dr. Patnaik there. And Dr. Indu Singh, she did the first meeting in Amritsar for a Vitreoretinal Society. Then we started every Saturday during the Vitreoretinal Society. We have DJ and make every vitreoretinal surgeon dance. The reason is, unless you have a strong back and a strong front, you cannot be a good vitreoretinal surgeon. Otherwise, you will have back pain. And 55% of back surgeons have. So this is the agreement of annexure to VRSA, where we made a contract between how VRSA conferences should be done. And now I'm happy Joseph has made the SOP for a conference. So my passion is vitreoretinal surgery. I actually took up this idea of one idea, make that one idea. That's my Swami Vivekananda, which I carry all the time. So he says, take up one idea, make that one idea your life. So my idea is ophthalmology. Think of it, dream of it, live on that idea. From ophthalmology, it became vitreous and retina, and let the brain, muscles, nerves, every part of your body be full of that idea, and just leave every other idea alone. And for this, my CEO wrote, you are thinking every minute, but your staff cannot cope up, so you stop sending messages after 5 p.m. So I have agreed. This is the way to success, and this is the way great spiritual giants are produced, and others are mere talking machines. And I know I am working with talking machines. And VR surgery has been passion because of Dr. Badrinath. I never wanted to be a VR surgeon. I actually wanted to learn microsurgery, and nobody was teaching me. And we had a microscope in ophthalmic hospital. As you know, I'm publicly telling, even now it's happening in Europe. The teachers will not give to the juniors the new machines. And here, the Bausch and Lomb machine, I didn't operate still in Mumbai, but Avik has operated. And that's what Dr. Badrinath did. Whatever new instruments he brought. I did the first endo laser in India, thanks to him. He brought the machine. He brought the first curved scissors from Dork and all the instruments from Doc, and I did the relaxing retinectomy first and not him. And that's the greatness of the teacher, because his teacher was Charles Capens, who also trained Dr. Namparamal Swami. So I think all the great teachers want their students to be greater than us. So I wish now Avik to excel us. So this was the lecture given a decade back. That means now 4 decades have gone. So I have that time performed more than 27,000. That was considered vitrectomy and combined. But now I separated and made it 65,000 vitreoretinal surgeries. And I am a proponent of scleral buckling surgery, which I still do, and I also do complicated trauma cases, and that's how I went to serve the humanity in pellet injuries in Kashmir. So the scleral surgery everybody knows, and I call it the fine art of scleral buckling, and we also how we do the drainage, and you can see how the retina is having detachment and how the retina is attached with a good vision. Even if the macula is off, we can do that. And other philosophy which I am popularizing, in 1984, Michael Belkin said, nobody should remove the eye after an injury, even if there is no perception of light, for the fear of sympathetic ophthalmia. And I am propagating that. I am sad to see it happens even in Mumbai, even now. In case I come to know, I stop it and make sure that the patient comes to us and we do the repair, even if there is no light. It's only it's the only thing in ophthalmology where you can operate when there's a trauma, not in any other condition. So this evisceration enucleation I strongly condemn for unless there is infection like panophthalmitis. So we have to preserve the eye and make sure you preserve the globe and get the best for the vision. So I follow Ferenc Kuhn, who visited this center. The trauma center is named after him, Ferenc Kuhn Ophthalmic Trauma Center here, and he was there in Sion Hospital also. And he's taught us the strategic thinking and have an individualized approach. Think again and again what's the most suitable line for a given patient. So we have to have a systematic approach and cannot have just like that trial and error. And that's what Ferenc Kuhn said, and he's published this in 2002. And timing of vitrectomy we should do as early as possible, and that's what we have learned. And these are the videos are not there. So, and we introduced the first retinal endoscope in Asia, preferential hyperacuity perimeter, the first four-eye domain optical. So I'm very proud to say that we introduced the OCT first in India, and then only the other Shankar Netrala and everybody, L.V. Prasad, Arvind got it. And photodynamic therapy, again I introduced first in India, sutureless surgery along with Dr. Mark Humayun, and biome, which is revolutionized by Dr. Mark Spitzner in 1987. Unfortunately, it was not popular in Germany too, even though the German company Oculus made it, but unfortunately it was not popular. I popularized from 1990, and now I remember till 95, the whole world was having resistance from moving from contact lens to non-contact biome. I don't know why, but I was happy because I wanted to buy something new. So when I took a loan, I bought the first biome in Aditya Jyoti Hospital, and I made whole world come to see how it is. And we also did the twin light endo-elimination vitreoretinal surgery for doing the bimanual vitreous surgery, and injected also introduced Lucentis first and now Vabysmo also before its approval, and many things like that. And first Constellation, IOL Master, the biome you see here. This is the biome 3, but I have the biome 1, 2, 3, 4, 5, and now 6 is coming just now. And I also made a curved cutter which was published in 1998, which was made by Dork. I don't know why, unfortunately we could not make it because the problem was how in the curved thing the cutter will work, but it worked, and I'm happy. Somebody said you can bend it, and Steve Charles used to make fun, why not you put this curved cutter in the Viagra solution, it will become erect, he said. And then this is the suction forceps I introduced, and then this is the OT table, because when Dr. Charles Keepens came to my OT in 19, he asked me, the patient is going to lie down in local anesthesia, and you can see there are 2 cushions in the table, because he said when you lie down for half an hour, as an old man I have back pain, what are you going to do for the old people? So I put a cushioned thing so that Avik, this is what we have done. We have put extra cushion. We should put it here, because the patient will have problem for if I operate for 3-4 hours. No. So because Charles Gibbons came and lie down, and then for neck also I made so that the neck doesn't pain for him. So that's why they move like this, and microsurgery it's a headache. So these are all small things, but so this I call as Maharaja chair. This back, this is what I know you are not happy, but I want to say, Joyce. So everybody, where is the Joyce? Gravana. The whole world wants to see you. Come here, Joyce. And I hope cameraman dekh raha hai na? So Joyce is there with me from 1988, and she is the nurse who joined me in 1988 in Bombay Hospital. Every OT in Bombay, she was with me, and made everything right from screw to nut to the everything she made. Thank you, and thanks for taking care of your grandson Avik. And so this chair, she knows I made the carpenter design, and now the Appasamy I made them do. And I hope the new chair, one more we have to get for us, so that I will use this. And I have designed a handrest where elbow weight will go to the back, and then the elbow weight will come near, and then only the lumbricals will work. So I think I posted last week in the Facebook what is the meaning of lumbrical muscle and how it will work. So I also made the first vertical Amsler garden. You can see Neil Bressler and Susan Bressler with Mr. Sushil Kumar Shinde, the power, what do you call the, he was the power minister at that time, Minister for Power. And you can see behind me is Mr. Ravichandran, who is the CEO now for Kamala Sundaram Foundation. And that time he was the CEO of Ayurveda Hospital. And then on this side is standing alone is my father. So everything is dedicated to the patient, and the Amsler garden is still there for the, because I got this idea from Singapore, where now I'm happy the airport is copying. They have vertical garden, but they don't have the Amsler garden. But entire airport in Mumbai, everybody should see that. It's an art piece where T2 has this vertical garden in every place where you board the flight. And thanks to that time Chinmay, Nayan Ghosh, my fellow, Hitesh was there, and now Samir is doing everything for me. So Bausch and Lomb is telling me, from there I can see Dakshina is telling, we have given you money and you are not talking. So now I am talking. Again I am not talking Bausch and Lomb first, because I don't have I don't take the money. I don't have any financial interest. So why heads-up surgery is important? He mentioned about the patient, how can we do 40 surgeries a day? I think Arvind, they do 100 a week, cataract surgery. A single surgeon will do 100 a day? Or no? No. One surgeon, how many you will do in a day, maximum?
Cataracts are usually 50.
Okay,
50
so he was
60.
telling that it will pain in the back, and then use the head-up, he is saying. I am sure Arvind will not agree for that, because 50, I don't know whether you can do it head-up, I am not sure. But the idea is head-up is important, because the main thing is everybody talks about, I think, because I think who introduced, I think RTO came with the head-up. Alcon came with the head-up, and actually it was True Vision from Japan. But main thing is Dr. Eckhart popularized it, and everybody said it is because boring to see through the binocular, and you have to see like this, and you cannot, no need to have no neck will be there. Now I remember one group of surgeons are complaining there is a neck pain looking to the right. Now Bausch and Lomb must come out with straight. But I think nevertheless, more important is to do exercise. All this ergonomic, I think, is not the, which no company should talk, but I think probably they don't know how to do marketing. So I think the marketing is, it's amazing. It is like I always imagined in my thing. Anybody is remembering that fiction movie where they put small micro video and swallow it, and it will travel into the gut. Now it is available as an investigation, but it was a fiction once upon a time. So I like that. I want to make an eye model and sit on the macula and see the lens, see the iris, and then I'm happy Dr. Siddharthan made something like that. I have given this idea to, once I gave it to the Consul General of Japan to do it in Science Center in Mumbai, because they have optical illusion. Even in Tirunelveli, it is there. The Science Center has I came and gave a talk. So there are, I think, 25 science centers in India. I went and met this not tourism, Ministry for Museums are there. I went and met him. That time one pediatrician was there. Somehow, anyhow, I could not impress them. But one day I will do it. And I think probably the Ratan Tata Trust will can do that, because I want to improve the eye museum in Madras, and also the museum in Delhi, which I got it done when I was in. The regular, Bausch and Lomb wants the regular microscope to go to the museum. Correct? So this is the first concern for a veterinary surgeon, to maintain a comfortable and stable position that allows to carry out the surgical procedure safely, which was published by my friend Romano in that time. And I think this was in the Eye Journal in 2018. It is always a thing. And I remember in the first time, I don't know whether you read the paper, most of the VR surgeons, when they are doing the ILM peeling, they don't blink. And they will have dry eye. And they will have stress. They will have watering. But I think I want to do a study to look into my eye. I blink normally, and I keep talking to the world and do live surgery. So I think it's in the mind, and I suggest to read that book, Concise Mastery, Concise, Mastery of Concise, what is that? Richard Green book, Concise Mastery. So you have to be a master in whatever you do, and he talks about neurons, mirror neurons which will develop. And this is what I talked about. I showed the chair, and I'm happy. The first thing which I used was Ingenuity 3D. I didn't buy, but I used it for demonstration. So we should give credit to them for that. The problem is they removed the eyepiece. So it was a headache. People who don't like, now RTO came with the head up, what is that, binocular and head up and 3D. And then they came out 3D and they removed the eyepiece, which is again a sudden change is the problem. So it has the high dynamic range camera, which is the best part of it. And high level of precision with the Ingenuity removes the need to focus without losing detail. These are all finer details which each surgeon has to learn to master. And I remember the True Vision guy came and told me, I'll give a lecture for a day, then only you can do this step and 5 minutes. I said, you keep giving lecture, but I will go and do like that. That's what I do for any new machine. I know you have to go through the manual, but for me everything is there, because I see the masters using it in the beginning itself. And this is a True Glow microscope made by Apasami. I think we have to give applause to them, because an Indian company making a 3D, and I think some surgeons in Chennai are using, and they have a complete 3D setup with a 3D digital recording. But still, they can't match the best. It is like the Indian car and the Mercedes. And then in the Mercedes again, the GLE and the GLS. And in the GLE also GLE 300, GLE 400. And I'm not talking about the money, but I'm talking the safety, the fantastic pickup, because that's the same thing we enjoy. But I enjoy speed. And I used to drive in the Autobahn in Germany with 250. And after a long time, I did in my BMW Pune to Mumbai in just 2 hours, from Pune Marriott to Dadar. It's risky, but I think that was the first time the Mumbai-Pune highway was made. And then now I did it in recently with Ferenc Kuhn in 200 kilometers, and he was really worried. He said, my heart was in the mouth. My driver had a heart attack. He's admitted today. And I still don't have. I don't like the roller coaster. My son loves it, but I love speed. But it's not good. But anyway, the reason I'm talking is all this needs technology, and that's what is 3D is about. And it's this is they also have for anterior segment, posterior segment, and this is an amazing future microscope, Ocutrex. I don't know whether you have seen that in Europe. No, I'm asking Dakshina. No. When you travel, you have to see here. And this guy, the developer name I forgot. You have to Google. Interesting story, Avik. The fellow who developed it, his father had a macular degeneration. So they are twin brothers, or brothers I think. They are engineers working on optics. So they have come out, they made first a low vision aid, something like eSight, and which they made for father, and they decided why can't they extend the technology to microscope. So they come with Ocutrex. So they are calling operating room bot 4900D surgical visualization theater, and it is actually a confidential information, but anyhow they demonstrated the microscope in Frankfurt Retina meeting 4 years back. This is how the microscope looks. It's a bot 4900 3D surgical visualization theater, amazing, and I think definitely better than SeeLuma, but I don't know when it will come. Camtrax digital microscope, which captures live surgery feed, which is displayed to 3 visualization sources depending on a surgeon's preference. And they also have on OR lens, which is a headset. It is a headache for me, I don't like it. But it's a Dr. What's her name? My friend Anat Lowenstein is using in Tel Aviv. I one day wanted to go, but now the war has started. And they have a stereo lens with 8K and a 3D glasses-free monitor. Amazing. And the problem is you can't transmit 8K still. And I think even the movies, Apple TV may have 8K, not in other things. So this is the comparison. So now Dakshina, I have given him homework to do comparison like this for our Avik, we have to do for the 3 microscope. So you can see the optical zoom. Ocutrex has 20x and Alcon has 20, Leica 16, and in this we don't have SeeLuma. So you have to add SeeLuma, man. I think I sent this slide to you. And then a digital zoom is 360 times, which is not available in any microscope. I don't think it's there in SeeLuma also. And micron resolution is 3.5. Amazing, yeah. We can't. I don't know whether we can do anything in 3.5 with now, and because we are working on 30 microns. And Ankur, do you know how many microns make 1 millimeter? Dakshina? 1000 microns make 1 millimeter. And then you can see 3D everybody has, and then color spectrum is 69B. I don't know what is it, and resolution is 50, and you can see the rest are 4.2. Amazing. I mean, it's like a dream. I don't know what is happening. They have not got approval. They took my signature for becoming a whatever you call, forgot that. So I signed. I don't know what happened. So they have this headset. I mean, you can see everything inside. How long you will do this with operating like that? No, I don't know whether you use the headset to see the. You know what is a headset for or Bayer for the ARMD and all. You can see how it looks and all. After 2 minutes, I get bored. And you cannot see the surgery like that and operate, no? The only thing you can do anywhere and do, okay. And you can see this resolution. They have 8K, and then you can see the brightness 85%, and no need for 3D glass. And you can see the Camtrax magnification. You can magnify that. This is a seed of a flower. And how the magnification, like right from 20 times to 120 to 240 times. And then this is SeeLuma, which is what we are all here for, because we have it in our own backyard now. And this is took from Dr. Lomb, and you can see, and you can see it right now here with we have a video, and I hope we can make a separate video of SeeLuma in the OT and put it in YouTube so that Dr. Lomb can also use it. Our patients can see how a free patient or a charitable patient we are going to do 3D. And you can see how the surgeon can sit erect. And you see the Bausch Lomb has made a picture. If you sit like this for morning 8 to evening 4 without a backrest, the surgeon will go. So Bausch Lomb should use their marketing slides with my backrest. And then you can see the features here. And again, you see the backrest, which never touches the back of the surgeon. So we should make a movie on this and make it, man. And we are 11:30 here. Where are the guests of honor and all? Nobody has come. Shubha has come. Shubha, come to the front, no? Call Anamika. No, call Anamika, no? And who else is required for and we need a stage arrangement, no? Jaideep has come. He has to give a talk here. Not come? So cancel. And so this is the SeeLuma which I used to be, as Dakshina said. So all this I don't allow the engineer to talk to me. I do it in 1 minute. I can sit there with any machine and I use it. So this is advantage. But again here, practice also there is no backrest. So if you sit like this for long, you will get back pain. And that's what happened to me when I went to Kashmir and operated. I had a severe cervical spondylosis. I went and got some pain management. My anesthetist was very angry because he said the anesthetist could have punctured my lung. It was so painful, excruciating. So I just went and gave a consent and I got it done. But I'm happy. I don't have any pain. She cut off some nerve in the back, and it's okay for me. And I'm operating. I'm okay. And I suddenly remembered there's a Dr. Lakshmi she's a Tamilian, married to a Maharashtrian. She's an anesthetist. And just because she's an anesthetist, I believed her and went. But when the consent was read and my anesthetist Sharma said, "You're a fool, man. How can you go and lie down and get?" I said, "It's so painful." She gave something, I don't know what, tricot and something. She did ultrasound something and cut off that pain nerve. Absolutely no pain. Otherwise, I couldn't sit, lie down. It was excruciating pain. And that is because I operated from morning 8 to night 11 in Kashmir without backrest. And this is the other one which is not available in the operation theatre called DRV. I think even Dr. Thanasis Nikolakopoulos is my friend. I hope you will see this in the YouTube now. He introduced this and it was there in Greece last week also when I went. It's amazing. This is used for watch technology or any fine machinery to check. And you keep the machine under that or a watch under that, and you can see that watch glass they use like that. This is beautifully magnifies it. This is the future of optical inspection, and that's they call it DRV, Deep Reality Viewer. Is the world's first and only digital stereo inspection system which creates full 3D HD images that appears to float in front of your eye. It's true. You sit there and it's beautiful, and you don't need any special glass or goggles, and there are no unpleasant side effects. That's correct. And you just sit back and view high definition 3D. That's my idea. Sit back and operate, which a pilot cannot do. And I love the pilot chair. I don't know how many of you have seen in the cockpit. It's beautiful. It will go like this, and straight back like that, vertical. And I wish what Dakshina. That's my dream, to get a pilot's chair for operation theatre. The pilot, not the one Dreamliner. And it is a remarkable invention which is already revolutionizing the way organizations view, capture and share 3D images of samples they are studying. They used it in the lab, but now they have brought it for wet lab. So they have the supreme comfort, they have exceptional ease of use, versatile, and again you can see nobody is using backrest. It's very bad, ergonomically not to work like that. One is exercise, go to the gym daily, do back exercise and also do sit-ups, like what we do for Ganpati, and then come and sit, and with a backrest. And it has a long base and has a powerful combination, real-time collaboration on a global scale. And you can see, and this is how the DRV looks. And this is Dr. On the tall guy is Indian origin from Goa, but he's the chief of vitrectomy surgery in Moorfields Eye Hospital, De Cruz. And he's a great friend. I have invited him to Mumbai. One day he'll come and operate here. He's working on artificial retina and also gene therapy. And this is Yannick Lemaire, was the president of Gonin Club, and he was here in 2005. And we did the conference in Nehru Science Center. It is called NSS. And the short form also formed to my father, N.S. Sundaram. And he told that time, it is there in the recording, he said one day it will become Natarajan Science Center. I hope it will happen, because my dream is not my name. Natarajan can be my grandfather's name. Idea is to teach people. Dr. Nidhi, I am going to ask question or you have to ask question. Okay? I want to know whether you are sleeping or how do I know? Give her mic, no? Dr. Nidhi. So this is how the DRV works. You can see that that's why when I posted this picture, somebody posted, see how my lumbricals and the circulation is there, because I do so much of microsurgery. Shubha, you checked with the Anamika? Yeah, she told me she'll come at 11:30. 12 to 1 we have to do online, no? அவர் இது கொண்டு வந்திருக்கீங்களா கொடுக்கறதுக்கு கொண்டு வாங்க இப்போ இல்லை 12 to 1 கொடுக்குறீங்களா and so this is the one which I right now using there and so we also did a study with Dr. Aditya Kelkar comparing the 3D and conventional microscope and published. So Avik, you should go through this paper and we can again work and compare with whatever you experience next 1 week with the with the SeeLuma, RTO, then also whoever is working on Alcon and have a comparative which is above all this companies and money and everything which we teach the thing. So both of them have come here. Dr. Robert Redak was here in January 19th and he got the oration and he visited this place. He just fell in love. Sir, you remember meeting him. You hosted him. And because of that, this Global Fighting Blindness Foundation has come. We have still not registered. And the headquarters is Mumbai. You can see that. And actually it is Chembur on the top right. So Dr. Ashraf Armia is a great teacher in the world. He is a consultant ophthalmic surgeon in Egypt. He is a consultant cornea, refractive, cataract, glaucoma and anterior segment reconstructive surgeon. And he teaches, somehow he is so famous, I don't know anybody have heard of him. And Robert Redak runs, is the head of the Polish, is the president of Polish Association of Association of Polish Ophthalmic Surgeon and also chief of the Lublin Institute, which is the first, one of the first trauma institutes, which is 50 years old, and probably during the communist rule in Poland. But amazing, such a big institute they have made for trauma in ophthalmology. So, you can see Dr. Ashraf Armia and Dr. Robert Redak have expanded the teachers, and it's amazing to see he is working daily. He calls me. He gives interviews in Poland, he gives in Egypt, everywhere, telling that Mumbai is headquarters. Sometimes I get jittery because they are planning so much. So yesterday, thanks to our Mr. Kumar, trustee here, he introduced me to the secretary, Rajini Saini madam, and she showed me the 11th floor. And 11th floor has 5,777 square feet, amazing, available for rent, 8 lakhs a month. I hope to rent it and teach the people all over the world and also run a optometry college and institute of ophthalmology here. And this is my second mentor, Relja Jonovich. I spent a lot of time with him last month. An amazing man. And he revolutionized, to tell the fact, whatever advanced vitreoretinal surgery is happening, he did it more than Macamar, more than Charles Keepens. But such an humble man. He didn't want anything to himself. And he said, what did I do? Anything? I am not your teacher, he told me. I said, no, you are my mentor. He didn't know I have anything. So, thank you for that. But right now the time is, what is the time? It's only 11. So you have time. So I can again talk something more. So why the main using the 3D, why I am enjoying is, so I am just telling about my passion on managing trauma. I told this in Shanmukhpriya last week. We had the Retina Summit of Asia Pacific Ophthalmic Trauma Society. I used to put torchlight for my father for removing corneal foreign bodies at daily 10 to 20 people. And I used to see why so many injuries are happening. And somehow I fell in love to manage trauma. So what I did, I think I took a needle, because I used to say my father using a needle or a foreign body. In the Parsons it is there, corneal foreign body removing instrument, which I used to do, which my father used to do. And without knowing, but they used to put drops so that the patient is anesthetized and you can remove the corneal foreign body. I didn't realize that. As a 10-year-old boy, I used to make my pet dog sit, and the dog also used to show the eye, and I used to use the ophthalmoscope and see the retina with a great difficulty. and it is looking shining. I didn't know what was there, but it was a tapetoretinal reflex. Then later he was using, because fundus examination was not a problem for the dog, but what I did is I opened the lid and put the needle on the cornea, and then it hit me. Luckily it didn't bite me. So anyhow, I am saying, so I was probably subconsciously learning trauma management even at the age of 10, but we all know that eye is protected. In spite of that, so much of injury is happening. So it's the number one ocular emergency, and it is the leading cause of blindness irrespective of age, sex and geographical status. Male and younger age group is greater in incidence, and efficient referral expected from professionals. So that is why we are calling this Chembur center as a ophthalmic trauma referral center. Apart from Sion hospital, they are doing as a total body and ophthalmology. So we expect everybody in Mumbai can refer here. People who cannot afford, people who can afford can go anywhere. And every person should know about the importance of quick response to an ocular imagery, and prophylactic measure is always better than management. So 18% of posterior segment trauma consists of intraocular foreign body. I am happy Avik is experienced in managing vitreoretinal surgery for that, and retained intraocular foreign body is 5 to 40% of all penetrating eye injuries, and these are the indications for removal of intraocular foreign body. So, and then I see many times they remove the foreign body, but the problem of visual rehabilitation or visual improvement is a problem. So here we have excellent instruments for Avik to manage. So I recommend a two-step approach where you do the initial repair immediately, whatever may be the day or night. We have to have system to repair the eye immediately and do the vitrectomy in the next 4 days. That's what he says, and I say first 100 hours. So vitrectomy should do a total vitrectomy and then do the best, all the advanced. So the main thing is it's not delaying, it's doing the second surgery. In the 4 days, you have a leaking wound is the problem. So if you are going to do the wound repair, you can do a airtight, watertight suture and do the surgery. And once upon a time, they were talking about spontaneous PVD, which happens 10 to 14 days, but you can't wait for it. Now the technologies, we have 20,000 cuts per minute, and we can do ultra-modern vitrectomy and induce PVD, and plus do the surgery. And that's what I did in Kashmir, where most of the young people, even if you wait 2 weeks, the PVD will not happen because the vitreous adherence is strong. And this is the location of foreign body, which is all based on the case basis published in journals. And the entrance rate also, cornea is in the front, so 65%, sclera in the side 25%, limbus is in between 10%. So the main thing is accurate localization. So history is important, knowledge of composition and size, delineation of the extent of ocular and orbital trauma, and decision regarding removal of leaving it alone. So I also like to thank Maharashtra Ophthalmic Society, which I should have done in the beginning, which they have given this meeting under their aegis. And now I can see Elton come here. Thank you, Elton, for all your support, and Shanmukhpriya also. So I think, and these are the various magnets we can use, and I remember we used a giant magnet, which is in the history in the museum now, and there are so many. Now we have the small pencil magnet, rare earth magnets, and we need so much of instrument armamentarium. And we had a Russian faculty, Dr. Sternov, who came in '95 and gave me this forceps, which is a wide mouth, large foreign body forceps, which opens 13 millimeter. And then we also have this ureter stone forceps. I've operated in Hinduja Hospital. I also used ENT forceps. Then I made this vitreous suction forceps. And thanks to Manish Papai, Mahesh Shanmugam, we three made this claw forceps, which is a novel intraocular foreign body forceps, and we have published this in Indian Journal of Ophthalmology. So all these procedures can be done at Chembur, and which is and then we can also use the perfluorocarbon liquid, which was developed by Stanley Chang, and we have all that, no, PFCL oil, and we also and then everything I've left to Avik, so he has kept everything ready. So these are the now you can see this is the video which has been done in Kashmir, where we have done the vitrectomy for intraocular pellet removal, and you can see the wound, the front of the eye was sutured, and the special incision I made in the 11:1 and made this four-prong forceps. I use this forceps when the pellet is within the vitreous hemorrhage, and that's my technique which I used. And you can see I can remove it through the separate wound, close that wound, and then continue the vitrectomy. So this is a pellet. So 1,000 people had pellet injuries in Kashmir out of 10,000 injury which happened. But every patient, it's a back-breaking surgery. I did 47 surgeries in 2.5 days. Similar thing we can do here, not in the catastrophe like that, but I think we can do one day maximum number of surgeries. That means we have 2 operation theaters here. You can see the pellet had hit and gone through and through next to the optic nerve, and sometimes it can hit and produce a hemorrhage. So the advanced vitreous surgery can give vision to badly injured eyes and make the patient see. And that's where our blindfreeindia comes. And one is to prevent injury, and if injury happens, we can do advanced surgery like this. And this is the retinal brush. I'm doing endo drainage. That means removing the fluid and injecting the air simultaneously. And this is another patient with a silicone oil where the retina is attached. And then we also have this is a 25-year-old gentleman with a firecracker injury. So Kamala Sundaram Foundation, as I said, supporting the Ocular Trauma Society of India. And Elton, we have made a Kamala Sundaram Foundation as funded Ocular Trauma Society of India. We have employed visually handicapped, or not handicapped, what is the word? Visually? Huh? Yeah, visually impaired advocate Rahul Bajaj as representing us. Finally, the PIL is taken in Delhi High Court. Hope to get a ruling to prevent this cracker injuries in children at least. We are not interested in banning because it's beginning. When we use the word banning, people are mistaking us. And I'm talking in a public forum, and this is in the court now. We are telling to regulate the cracker sale in India, where the Netherlands government, my friend Dr. Dijard, has got it fighting with the government and the public. He got totally banned in Netherlands. Singapore is banned on their own. China makes the crackers and sends to all over, and it's banned in China. So this patient had you can see the devastating injury happened because of the cracker. The total eye was become blind, and I'm doing this vitrectomy, and you can see it, the vitreous is charred and looking yellowish, and which is supposed to be transparent. That's how the patients can see. And the vitreous is the glassy material in the back of the eye, where we have in the camera where we have a space between lens and the film. The same is the vitreous, and that's now filled with blood. So we are removing the blood, and there are particles which has gone because of the cracker. When it explodes, they sometimes keep it in the coconut shell or in the bottle or whatever. So the problem is many things are small particles get into the eye or face, and unnecessarily people go blind. And they use rocket. There was a guy, they used it in the wedding engagement or the day before, and you can see there is a small foreign body within the vitreous hemorrhage, and now I am grasping it with the forceps which you have designed, grasping it and removing it. So any of these injuries can produce devastating to the eye, which I think we are experienced to repair, and that's what Kamala Sundaram Eye Center will do with Dr. Avik. But why can't we prevent it? And I think we should have some preventive pamphlets or e-brochures to give it to the patient. And you can see the pellet, maybe there are 2-3 foreign bodies, and we are again grasping from one more and removing it. So you can see this is vitreous, within vitreous hemorrhage which is grasped, and now we are removing it through the incision which I made. So this is a fine intricate surgery we are all trained to do, and Avik showed his video in the morning, and it was excellent. He has excellent hands, and happy he does better with his surgery than me. So that's important for the poor patients and the patients who are going to pay less, but they will get the best care here because we got technology, we got experienced surgeon, we got good staff who will assisted him, and we have Joyce who's there with us for more than 39 years, who is like a mother supporting us, and Mahadev who's come from, who's with me for 35 years to do all this for the poor people. So this is, I think, took 3 hours surgery to repair the eye, and we get vision. I mean, again, patients in Aditya Jyot, we have a program when a patient like this has no vision in that eye, and we operate, and when we get vision, 6 weeks later, we celebrate the vision. The meaning is, we celebrate the patient has got vision. We thank the God for with the gratitude that he got vision. So we buy cake, cut the cake, and if the patient is diabetic, we don't allow him to eat. He cuts the cake and gives to all the people, and then we also thank God. And then if he likes, he gives an interview, and that's called Happy Smile. So we should start that here, Avik. Your patients, even cataract. Today we are operating, he is almost having a cataract with and blind in one eye. He's a diabetic, he is not done. So I'm happy this video I got today. This video I was searching some time back. Oh, what happened? So this is a glass foreign body. Video is not playing here. Samir? Samir? The video is playing here but it's not working there. Why? नहीं इधर काम कर रहा है. समीर किधर है? समीर प्ले वीडियो इधर नहीं video is not playing. Why? So this is a foreign body video I was searching. Today I got it. बाद में चेक करेगा. ठीक है. So we'll edit and put it in the YouTube later. So this is what I operated in 1991. You can see people appreciate that I got videos from 91. Actually I got from 84 also. I don't know where are they. And because of that only I got the prize in 1988 for the best video in All India Ophthalmology Conference, and that's how I came to Mumbai. So you can see this is my voice in 91, but anyhow I am cutting short. You can see the emblem, which was a round one, which is exactly similar to Shankar Nethralaya. Dr. Badrinath used to scold me, and anyhow then Allah blessed me. So there was a foreign body in the cornea which I removed. Now actually I am removing using I couldn't afford diamond night 91, so I used the blade and I am dissecting that. This was a simple that bow and arrow injury when this that time the bow and arrow Ramayan was going on. So everybody was playing bow and arrow with a broomstick, and this was that broomstick injury which came from Pune, I remember, almost a few days later. You can see that part of the broomstick which is there in the blade. I removed it and then produced an inoculum of infection into the eye. And now I'm using a 20 gauge. That's what we were all trained. And we have also done vitrectomy with the indirect ophthalmoscope, which Dr. Namparamal Imstami started, Dr. Nakpal, Dr. Badrinath and myself. They are elder to me. They are all 80s, 85. And anyhow, I have done, even at the age of 27, maximum number of vitreoretinal surgery, and I was a young vitreoretinal surgeon that time with the experience. How old are you, Avik? 30? 33, good. So anyhow, 27, I was on faculty with Dr. Badrinath, and I used to be equal with Dr. Namparamal Sami and Dr. Nakpal. And Dr. Jovanovich recognized that in 1986 and told he looks like a resident, but he knows more than all of us, thanks to his blessing. I am not telling all this for my boasting, but I want people to know, young people like Dr. Nidhi, she can become an expert one day. Not today, but one day. So I didn't have any inhibition because Dr. Badrinath took care of me like anything. So this man had an injury with a thorn, which happened in near Sangli. He fell down while he was cutting the thorn, the thing for a fencing, and he didn't even realize the thorn went in. He just rubbed it off his eye and went away. And next day the eye was red. He was putting some drops on his wound, buying antibiotic from the pharmacy. And 2 weeks later he went to the doctor. Luckily he didn't develop endophthalmitis, but he developed uveitis, and everybody was treating him some redness and uveitis, and this was the entry wound of the thorn. And I tried dissecting, and I didn't know. I didn't know because of what was there, and I didn't know whether I'll find a foreign body. But I was exploring. You can see severely inflamed eye, steamy looking anterior chamber. I cleared. There were exudates in the anterior chamber. I used horizontal or vertical scissors to clear it. You can see hypopyon. Now I have done a lensectomy, vitrectomy, and I cleared the debris in the midvitreous cavity. This was in 93 with a video. I'm happy. Like this, we have to get old videos and put it here. So now you'll be seeing this. You can see that was only I don't know how many cuts were there in 93. 800. You can see that so slow it is, and I cannot believe that we were doing this. And anyway, that's how the surgery develops. So slowly, now it looks like, now you can see the thick hypopyon, which I'm removing using a needle. And I have the habit of sending everything to Dr. Bishwas that time into Shankar Netralaya, and he will do a study and give a report sincerely. And he was charging only 200-300 rupees for that. And this is a vertical scissors which I talked. The exudative material was there on the surface of the eye. This I called anterior chamber cleaning. So I am like a street sweeper, where you have to clean everything, the eye. And this is cleaning the eye, surface of the iris. And you have to be everything needs. But Dr. Badrinath taught me, your hands should be like Bharatanatyam dancer hands under the microscope, and not like a devil. So that means it should be so fine, and then whatever you do should not injure the iris, and underlying, or producing a dialysis, then you make the complication more, bleeding more, and you can even lose the eye. So that's where your expertise, the steadiness comes. So I think yesterday Tia was in the OT and was talking about tremors and how your hands are steady. And I think thank all my 3 generations, God, for that steady hands, because without steady hands you cannot do that. And I'm happy even today I have it. I hope till the time it is there I will operate. After that Avik will take over. So it's taking time. I say the time is 11:20. So I'm engaging the people who are watching. YouTube people are watching. So you can see now I'm using the cotton tip applicator and depressing and cleaning the pars plana. Avik, can you guess what is there? I'm depressing the pars plana and cleaning. What I thought that time I'm only doing the exudates on the periphery, in the pars plana region. And slowly I see something brownish, then I thought it is choroid. I was thinking, so I was slowly touching and seeing what it is. Finally it was thorn. And the thorn is, you will see, it is 13 millimeter and totally merged with the, camouflaged with the exudates, choroid, and the back of the iris. And in ultrasound, we didn't have a good ultrasound that time. And Dr. Deepak Bhatt used to come and do ultrasound and then learn inside the OT how to interpret. So he had a first-hand knowledge of him. So you can slowly see that is the thorn. So when I identified it as a foreign body, then I went to the posterior pole, cleared everything. And you can see that this was a biome, but the problem is the light pipe was only 30 degree. And when the biome introduced, Dr. Spitzners was ahead of time. And the light people did not make a 60 degree and wide angle light. I mean, all sorts of problem. And so when you illuminate only one part, you will see. So you can see now I am clearing the debris, and now I am using the Macamar forceps. So I am holding the Macamar forceps and then illuminating. You can see the thorn now. It's a 13 millimeter thorn. So when you remove, if you don't catch carefully, 2 ends will damage the retina. So you have to really have the 3-dimensional view in your mind and imagine where you are holding. So I was holding like this. Every time I was careful. This I think I am holding in the left hand. Then I now will make a corneal incision. So this now I'm thinking what I'm going to do. And this is a 20 gauge infusion line. And then I knew that I cannot remove it through pars plana. So I'll use what do you call viscoelastic. That time we had methyl cellulose to inject the endothelium. So again I have only the blade. So Dakshinamurthy, Vallavanukku Pullum Ayudam. You can translate. Shubha and Avik don't know. So if you are an expert, even a grass can be used as an instrument. So you can see now I'm making a corneal incision. Then now I'm injecting methyl cellulose in the AC to coat the endothelium and make sure you catch the tip. And you have to do acrobatics within the eye. And that's what I live inside the vitreous all the time. So you can see the 13 millimeter thorn. Na Shubha? Shubha, see the thorn. 13 millimeter thorn from inside the eye. I welcome Veda madam. You can come to the front or sit with the Shubha. Shubha will teach you what is the operation going on. Dakshina, Dakshina, meet Veda madam. She is our new volunteer. So now I did a cryo. I don't know why, but there was no break. But I did it. I did a belt buckle. And Dr. Jovanovich used to do a silicone rod, and you can see lot of exudative material removed. So I'm actually seeing this video after so many. This is another patient where you can see another wooden piece covered by exudate, which was a irregular rectangular shape, but not so big, but it was again playing with some wooden thing, the wooden chip went into the eye. So never give up, and that's what Dr. Gopal was talking last week in Shankar Netralaya. Every wooden injury will not produce fungal injury, a fungal infection. So it can be luckily. So you can see this wooden. Avik, you saw the wooden one? So you can see this wooden piece. So I think maybe I have done the maximum number of trauma patients in the world, because I think right from 84 I am doing, and even now I like to do. See, this is such a big, I removed through pars plana, and this is a double perforation, foreign body beyond the orbit. So I don't know what I am doing now. I forgot. I used some needle. And this is another eye. So Dr. Nidhi, you want to ask any question? Why? Avik, you want to ask any question? Or you want to talk? Any question? Already Amara Vaishali madam is yawning.
Sir, anything like your seeing your videos, those are definitely wonderful videos. Any particular thing you do for metallic and non-metallic to separate? Like for non-metallic foreign bodies, do you do any other maneuver other for for the
non-metallic? This one I use a handshake technique and use two instrument forceps to grasp it and remove it. And metallic you can use the foreign body. So I actually didn't publish. I introduced the handshake technique. Hold the foreign body in the long axis and use the other hand to exchange, grasp and remove it, because removing the foreign body is the problem. But now you will see this one I am doing another technique where it is near in the pars plana region, clean 6/6 eye with a clear lens. So I actually use this rare earth magnet made by an Indian one, and you can see I will remove it from the sclera wound only. So this is a magnetic one, and usually I don't like to remove from the same wound. Yeah. But here pars plana also was a problem, and neither it was inside, but it was intrascleral. Okay. And there was a vitreous loss. Then obviously that means from pars plana also the injury has. So I did a wound toileting without going in, using the vitreous cutter. So the idea was to do the wound toileting so that the water flows out and I'm using the infusion line using 23 infusion. If you see, I have only 2 ports. So now I'm using the magnet, and because I don't know where was the foreign body. I didn't have endoscope that time. Then after that I bought endoscope. See, now I'm trying to meddle with through the same wound, which generally I don't do. So metallic I use if it is a magnetizable, that's why I have a presentation metallic, magnetizable, non-magnetizable, and that's how I have all sorts of forceps with me. And now I saw a beautiful forceps designed by Arvind Hospital, Madurai. I forgot the name. It's called, it is like that. So this is a foreign body, you can see. So, and the patient maintained 6'6".
Amazing.
And I don't know where was the foreign body. It was probably anterior to the lens and somewhere in the pars plana. So this was iron piece. You know this rare earth magnet, who makes it? You should buy here. You should buy. It's not expensive.
I have to check, sir, because in Arvind also used to use a very old one.
We made a list because I used to, because I had a tough time starting a vitreoretinal surgery in 90, because nobody was doing in private. So Dr. Nagpal was doing, but he also was doing the, so I just injected air in the conclusion. So I made a list of instruments which company makes and who supplies, and then I gave it to every participant from 91 every year. We had Sister Elsie who made it, and now I think we should make it. Joseph should know, because we have bought from various companies. You can help anybody. There's no competition.
Sure, sir.
So the prognosis is different, and as I said, we are doing this training here, and which will be done in this center. And Joseph, where is Joseph? But we need Shubha. We need this thing for. No. Make a stage arrangement. No. Where will the chief guest and trustee has to sit? No, 3 of us. No, we have to put that. He knows, I think. Can you call Joseph Vishwas? So this is the other one which I'm happy Dr. Avik is specialized in this. Refined reconstruction of traumatized eye with no pursuit of light and restoring best vision. We talked about all these injuries. So this is what we have to do: strategic thinking, systematic approach, and then today we have to decide when to do. And this is a 76-year-old male who had he was the principal secretary's father from Maharashtra government. So this is how the eye represented. So the injury was in Lucknow. The next day he came. I think that was a mistake of doing a belt buckle, and I injected a viscoelastic, and also eye was fully full of blood, front and back. So I did this belt loop, and I did all around the eye. So everything I do under 3D, and you can see I'm doing the 23 gauge. So you will see this actually, in spite of all the experience, there will be a bulge happening now, and I thought it is a wrongly placed infusion line. So by the time I realized it was a expulsive hemorrhage, and I didn't realize it. I was proceeding and I was doing something. I was not nervous, but I didn't know what was happening. But I injected a heavy oil, I injected air. When I realized it is this, expulsive hemorrhage, and I did remove the band because no use that time, and then closed the wound. And then 2 weeks later, I did the surgery, and this was eye like that. And then I did a vitreous lavage. Because expulsive hemorrhage, everything was expanding, the retina tore, and there was a large retinal tear in the temporal side, and also macular hole. Now we need a stage arrangement. No? You can do it now. Start doing it. Thank you. So you can see the large tear and a subretinal oil. So I went inside behind the room and removed the oil. So Dr. Nidhi, have you seen surgeries like this? So you should come and be observer. So macular hole I don't generally do, but I did an endodrainage because I knew that if I use PF seal it's a problem. And then this was the eye at the end of 2 weeks, and then we did that. So this is a pellet injury which was done in Kashmir, thanks to एक टेबल रखने का ना, or you can keep this table you can keep, no problem, enough. No, just to keep some water, and that's okay, you do it later. No problem, no, that's okay na, camera is here, anyway we are going to edit it. So this is how the wound looks, and this is the previous patient's macular hole also I did laser, and patient got 3-meter vision. And this is a 63-year-old grandmother playing with a grandchild. Her leg slipped and fell, and she got injured with grandfather. This grandmother played with the grandchild, and then when she played, the grandchild was slipping something. She got injured with the tip of the table, and then lost the eye. And then I did this surgery. So you can see she came with multiple hemorrhages all over, and then almost I think 4 or 5 surgeries I have done. Your torch is on. Your torch is on. Unga torch on. Illa, unga light la. Sir, meet your meet our trustee. So this patient, this old lady had a injury, and then now I'm removing the scar tissue because multiple operations done, bleeding happened, and the whole idea is to remove the membrane, and you see that was the membrane and retina is totally attached. So the philosophy is to repair. However, the chance is only 1%, still we'll do surgery. Joseph, I need Elton here. Joseph, Elton. So we have started this Kamala Sundaram Eye Center at Shanmukhpriya. Thanks to Shanmukhpriya for this is my idea, philosophy. Now I am living with this idea, blindfreeindia. My vision for screening to surgery for proliferative diabetic retinopathy. If the OT is ready, we'll operate at 2 o'clock today. And Samir, where is Samir? And audio visual, I need 2 to 5 also separate link which Samir will make, and we will send it after 1, because 1 to 2 will be lunch, 12 to 1 we will have inauguration now, and 2 to 5 also we are planning to, the OT is connected, no? Samir, where is Samir? Hello Rohit, is the OT cabling done? From the microscope to the, why? So we can't bring the, but already he is recorded in 2 hours. Samir is here, Elton is here. Elton, you know, all these are going live, but you know what I do? Tomorrow we will delete this and put an edited one. And people will know about me. Okay, this is a presentation for you. And I am happy Shanmukhpriya bought this idea of running eye center, but only Elton has taken my idea totally, and no other friend. Thanks to Ravi, I showed Ravi's photo also, but Elton is the only one, and followed by Shubha. So diabetes is now the epidemic. Samir, we need 2 to 5 नहीं कर सकता है live surgery. OT में कर सकते हैं ना, OT से live YouTube कर सकते हैं. I will check means where. No, what I am asking, now we have connection from whatever YouTube connection, and live surgery will be seen in the monitor when I'm operating. And same thing can be transmitted, no? So send a separate link after one, so everybody. And that is again we'll edit and put. So diabetic retinopathy is a major cause of blindness in the working middle age problem, not only in India, globally. And the eye is also called globe. So, Elton, this is what we want to prevent sitting in Shanmukhpriya Center as one. Diabetes can affect eye, produce all this problem and blindness. It affects the brain and produces a transient ischemic attack, stroke and cognitive impairment. And then it affects the next is the heart and produces high blood pressure, coronary heart disease, angina, heart attack. My driver is admitted in Kikabai today. And kidney, we have dialysis here. So, and neuropathy, we have my friend, I saved his eyes, but now having neuropathy problem. And extremities, we have peripheral vascular disease. So, all this can be prevented, and money of the people, money of the government, and whatever we are getting donation can be used for something different by teaching in the 11th floor. So that's why I want you for the presentation. So diabetes can lead to severe damage, and many people are like United Kingdom realized it long back. So they have a Queen Elizabeth medal. If a diabetic patient lives 25 years with diabetes with no complication, they get a medal. If they live with no complication for 50 years, they get another medal and more money, some pounds. And I think we should start some scheme like that. We don't know how to do it, but we have to do. And this is the publication which is in Lancet, which has a high impact journal, published from Chennai by my senior Dr. Mohan Vishwanathan and Dr. Ranjita, daughter. 101 million people are living in India with diabetes. 11.4 people of India, 11.4% of 1.45 billion people in India are having diabetes. And government of India is saying 136 million people are living with pre-diabetes. That means they can get, and then 15.3% of, again 1.45 billion people are having. So somebody who is good with numbers should work on it and work on health on my. So what is diabetic retinopathy? This is for you, sir, trustee of Shanmukhpriya. Diabetes is a serious eye disease. Retinopathy is serious that can cause vision loss and blindness with people. And he will tell you more. What, sir? Subramaniam, sir. You will tell, no? And the temple is in your name. And it occurs when high blood sugar level damage the retina. And I want to tell you that diabetes sugar in your mouth affects every cell in the body. And another thing is true, whatever you think, every cell will listen to you. So that's why I don't wear glasses. My eye listen to me, I don't wear glasses. And complications like this happens. And all this we need ultra-modern instruments where we got 5 crore from Sahachari Foundation, GBK Foundation, ACG Foundation, Elton, and then thanks to our, what is the foundation helped us? No, trust. No, that I have told. Your friend, Nipa Sheth and Trust Group, and then yesterday, Kothari. So thanks to all of them and everybody, Mr. Elton is taking, and I told Avik and Joseph that you tell us what you want to prevent blindness. We are here to collect the money. And it's not only Elton, me and Ravi also. So we spend money on doing this test, fundus fluorescent angiography, then ocular coherent tomography, which I introduced first in India, ocular coherent tomography, angiography, and they call the short form of octa. Hello. And we have Dr. Rahul, our anesthetist. Thanks for coming, sir. Today, are you the anesthetist or a guest? You are a guest. Thank you. Huh? I know. And B scan. So we need money for, I think, no, we are getting it from other, we have to write down a grant. So all this needs money, and we need a laser, which we have, and we do pan-retinal photocoagulation. We need money for injecting the eye, and then we need surgery, which is what, like this, if you don't treat, eye gets membranes like this, and they go blind. And if you don't, and then this is what I do, and now Avik is doing. He did already last week, and today we are going to do together. This is the sutureless surgery, eye surgery, which we introduced first in India my friends introduced Mark Humayun in the world in 2004, and Mark Humayun was here, and he also he got the IPR for artificial retina. So we have to do this advanced surgery. Again, it takes hours to do, remove this membrane, and membrane is like a thick sheet on the surface of retina, and when you pull it can tear, and if you tear, the eye is gone. So that's where the delicate surgery is. It is like silk cloth on a thorn, and if you pull a silk cloth and the thorn, nothing will happen, thorn will tear the silk cloth. So that's where our surgeries are, and you have to do meticulous surgery like this, and then finally clean the eye like that, and the retina looks so beautiful. And this is what it took hours for me, and the patient got vision. And this is what we have, the various microscopes we talked about in the beginning, 3D surgery. So diabetes is an epidemic happening, and every diabetes will be affected with something. And that is where our dream, which Vishwas is working on the concept and publishing, from the age of 35, every diabetic should do HbA1c. Thank you, madam. Padma Ramurthy has come, and Padma is a great Bharatanatyam dancer. So she is going to perform today. Madam, you are going to perform now. I told about you before you came. Dr. Badrinath told me the surgeon's hand, that is retina surgeon's hand, like me, he will tell me, hit it with the microscope. Don't come like a devil. Come under the microscope like a Bharatanatyam dancer's hand, because the hands speak. Same thing we deliver in the eye. Yes, this means eye. And he told me that. And every day we used to play MS Subbalakshmi, Korai Ondrumillai Kanna, in the morning and operate. Start at 8 o'clock and go until 1 o'clock. So eye symptoms are late. That is why our social workers are here. They have touched 300,000, 3 lakh houses and 12 million people in slums of Mumbai, not only Dharavi, Govandi, Dahisar, everywhere. And we have 2 vans, thanks to, where is Mr. Kumar, sir? He is going to arrange, and where Ranjana madam also is going to come and help us, give us the place. So we have to do prevention, and that is what prevention is better than cure, which we learnt in medical college, which is there in the subject for last 75 years in the medical curriculum, but we don't prevent. And all subspecialties have come, like a surgeon like me only doing retina, somebody is doing only cataract, somebody doing glaucoma. So I mean, it's a day of specialization, but if we prevent, nobody will have work, but that doesn't happen. 1988, the Moorfields team came to Bombay and told me, Dr. Natarajan will put you out of work by doing laser to every diabetic. Nothing happened. Even today we are operating. In spite of I am telling, we will have problem, but we can reduce the burden so much so that people will live happily. So we need endocrinologist, we need dietitian, we have Hema madam here, we need ophthalmologist, we need social workers, we need women volunteers like Veda madam and Padma madam and Shubha madam, and then they have to learn from Meenakshi Tapeta. So this is the one which I did as a president of All India Ophthalmic Society, screening through teleophthalmology to prevent diabetic blindness, the acronym called Stop Blindness. So I am happy Elton is working on it. So the idea is to do screen, diagnose and treat. And I don't know whether any of you have worked in cancer. In cancer, Government of India has made a law. If you screen, do a camp, screen whether it's cervical cancer, breast cancer, a lot of camps happening. And if you screen and find some cancer, and if you don't treat, you under IPC, you can be arrested, you can be punished. And that is what is not there in diabetes, unfortunately. But anyhow, Shivanandan, my best friend, says there is law. If you do a murder, I forgot IPC what, for murder is hanged to death. He says, how many are hanged? Welcome Anamika madam, please come. Shubha, welcome Anamika and come here. Nidhi, you can come here. No, inga ukarunga madam, Padma, ninga minute ukarunga. Hello, ukarunga madam. And Anamika, you have to meet the Bharatanatyam dancer. And Shubha, come. Comes to the front. So, can you give some coffee to the chief guest? And also to Padma and everybody. Srushti, can you get people to get whatever coffee, snacks you have, no? Give. Yeah. So anyhow, this is the idea. Sorry. So, Elton, that is why Meenakshi and team are doing this. Every day they are doing pre-camp awareness. Assembling diabetes is a challenge in anywhere in India. They don't want to come because they think I have to go for work. I don't have time. I'll not give blood. I've eaten now. We can't do fasting, but they are doing it daily. Then we can capture images. We can train anybody. So I call it ABCD. Then we can. This is what I want to do for nationwide screening. And the problem is we only have one ophthalmologist per 100,000, and 70% of India live in rural area and urban slums. That's why we need teleophthalmology, and that's the great contribution, no financial interest. And then we want to use the offline AI, and this is so simple, Elton. You should also learn to use it because you will pick up in 2 minutes. This is a mobile phone, and that's how the photo is taken by that any boy. Nobody know English. A Oriya boy or a UP boy can do it. Instead of, I want to tell the UP Chief Minister, instead of having that Romeo police, train them for doing this. So this is how the AI can be applied, and then they can diagnose. So no need for any technician, even Vaishali can do. So this is how the photographs are taken. And this is in comparison with the 50 lakh camera we have. We have published in JAMA, and this was the best term. So thanks to my friend, Dr. Kalam. He has come and met, I think, Meenakshi, are you there in this photo? He has come and met every staff of Aditya Jyot Eye Hospital, Aditya Jyot Foundation, because he gave the name in 2005 as the President of India. You can see he was standing and giving a talk, and I was sitting. And the ADC was getting angry, but anyhow, he was such a kind man. He says, no protocol, no problem. And then this is my father and mother. The center is named after them. These are our trustees. And then we do with BMC daily, and you can see our Vaishali, even under the tree they sit and do, and I salute them. And when I tell this, I'm really in tears because I'm in tears with joy, and I'm emotional. Thank you, Meenakshi and friends. So I follow Swami Vivekananda. So he says, they alone live who live for others. And Tirukural number is 224. Settarukul Vaikapudam. That means they alone live who live for others. Rest are equivalent to death. Thank you. So can we have the arrangements done? 10 minutes we have. And in the meantime, I want Avik to come here. Where is Avik? Avik? OT? Okay. So Elton, can you entertain till we sharp 12 o'clock we'll do the inauguration. You have to, we need a Raj Kapoor here. That is Mera Naam Joker. No, you come here. I want you to keep talking. They will do that. So Elton is my mentor for gym, spiritual, body, mind and soul. Come. We'll have the stage ready by the time.
How smart is this?
Very good. Yes.
I saw you. Hello? Hello? Good afternoon, everybody. How are you doing? Welcome, Anamika, madam. Lovely of yours to join us at such short notice. Really graceful. I want to thank Sahachari. I would like to thank Shanmukhpriya for hosting us, Kamala Sundaram Foundation, and giving us such a beautiful place in Chembur to help the Blind Free India movement. This has been a brainchild. The seed has been sowed 125 years ago by Dr. Natarajan's great-grandfather, I happened to join this journey just 3 months ago, where I was inspired by the speech that he had given at the Sion Hospital regarding his grandfather, his father, and him taking the baton forward towards a blind-free India. It is surprising to know a small country like Sri Lanka is one of our major donors for the retina. Ma'am will be aware of that. And trying to get people to understand what he's been talking about is so very important. I am very grateful to all the trustees, especially Mr. Kumar, for supporting us wholeheartedly. Dr. Devesh, who has been instrumental in setting this whole unit up. It is amazing. And above all, Dr. Natarajan for spearheading it. His vision is absolutely stunning. Who am I forgetting? GBK. I have to thank GBK, who is financing all our special work which we are doing in the slums of Mumbai. Thank you. So should we start the program, Dr. Natarajan? Thea. Let's start now. Everybody's come, I think so. Welcome, Mr. Kumar.
Hello, good afternoon. I request all the dignitaries to come on stage. Dr. Anamika ma'am, Professor Dr. Natarajan, and all the dignitaries from Shanmukhpriya, Subramaniam Samaj. Please come on stage. Mr. Elton. I request all the dignitaries to please come on stage. Subramaniam Samaj trustee members, Mr. Elton. We'll need some extra chairs, please. Arey, you can't stand. You are one of them. अभी से मत चलो, टाइम है, आफ्टर दैट. Uh, Good afternoon, distinguished guests, esteemed colleagues, and fellow practitioners of ophthalmology. Welcome to this special CME session organized by Kamala Sundaram Eye Center at the facility Shanmukhpriya Healthcare Center. Today we gather to inaugurate this beautiful facility. I request everyone to be seated, please. Today we gather to inaugurate this beautiful facility and also to explore the revolutionary world of digital and 3D technology, microsurgery innovations that are truly transforming our field. I am Shubha. I am Executive Assistant to Padma Shri Professor Dr. S. Natarajan. I am the Master of the Ceremony and I'll be taking you through this session. Special thanks to Bausch and Lomb for supporting this CME session. We'll begin today's program with a moment of reflection and gratitude. Let us commence with a prayer that will guide our learning and inspire our commitment to advancing patient care through technology. I request all the guests to please arise for the prayer. Can we play Saraswati Vandana, please?
श्रीप्रदा पद्मनिलया पद्माक्षी पद्मवक्त्रका शिवानुजा पुस्तकभृत् ज्ञानमुद्रा रमापरा कामरूपा महाविद्या महापातकनाशिनी महाशया मालिनी च महाभोगा महाभुजा महाभागा महोत्साहा दिव्यांगा सुरवन्दिता महाकाली महापाशा महाकारा महाङ्कुशा पीता च विमला विश्वा विद्युन्माला च वैष्णवी चन्द्रिका चन्द्रवदना चन्द्रलेखा विभूषिता सावित्री सुरसा देवी दिव्यालङ्कारभूषिता वाग्देवी वसुधा तीव्रा महाभद्रा महाबला भोगदा भारती भामा गोविन्दा गोमती शिवा
Blessing accompany us as we embark on today's journey of discovering and learning. I request all our guests to take their seats, please. We now invite all our distinguished guests who are already there here to traditional lighting of the lamp, a symbol of knowledge, dispelling darkness, much like how innovative technology illuminates new possibilities in microsurgery. Dr. Anamika Chawhan, all the trustee members, respected trustee members, Mr. Dakshina Murthy from Bausch and Lomb, Professor Natarajan, request everyone to be on stage for lighting the lamp. Srishti, can you help with the candle, please? I hope I have not left out any names. Sir, you can help me out if I have left any of the names. Yeah. Mr. Kalyana Sundaram, sir. A huge round of applause, please. Sir, please join. Sir, please join. Subramaniam Samaj is going to honor Professor Dr. Natarajan with Prasadam. Thanks to Dr. Anamika Chawhan, I'm standing here. She's written this script for me. I request all the guests to take their seats, please. I welcome Dr. Natarajan. It is my distinct pleasure to invite Padma Shri Professor Dr. Natarajan, one of the most respected vitreoretinal surgeon, professor and leader both nationally and internationally in the field of ophthalmology. He is the managing trustee of the charitable institution Kamala Sundaram Foundation, who has set up this clinic, Kamala Sundaram Eye Center. And he is also my boss, so I hope I have introduced him properly. I request Shruti, Meenakshi, our lovely ladies of Kamala Sundaram, to hand over the bouquets as I announce. Madhuri, Sarika, P.S. Kumar, no? No, I'm going to announce this. See, I'm going to... Saran de? Natarajan Sarana book ताटामध्ये याच्यामध्ये आणि देताना हातात काढू. I request Shruti to give flower bouquet to Dr. Natarajan, please. Yeah. I request our next volunteer to give flower bouquet to the trustees of Shanmukhpriya. I'll list out the names. Mr. P.S. Kumar, Mr. H. Kumar, Mr. Shyam Gopal Krishnan, Mr. Ramachandran Chellam, Mr. S. Kalyana Sundaram, Mr. S. Ramadas, Mr. Ramanathan Subramaniam. Please guide the way to where who is seated, please. I request all to give a huge round of applause. अजून कोण आहे त्यांना दे ना, 4-5 नावं मी वाचले ना, त्यांना विचारून दे. पटापट दे. इथे पण मीनाक्षी दे सगळ्यांना. हे पण आहेत, हे पण आहे. लास्ट त्या सरांना यांना पण bouquet for yeah, you can give. Yeah, bouquet to be given to Mrs. Mangala Subramaniam, please. Okay. Very good. Good to hear that. Lady power. I request a bouquet to be given to Dr. Anamika Chawhan, Mr. Elton. Huge round of applause, please. She is the guest of honor for this inaugural ceremony. Mr. Elton. Mr. Ramanath Subramaniam. Chennai. Maroon shirt. Recycle करो ना, सर से ले लो, दे दो वापस. Same. Yeah. Thank you all. Mr. It's done? Give in. Give in. One bouquet for Mrs. Padma ma'am. I request Rajni ma'am. I request Mr. Srivatsal sir to be on stage. Shawl नहीं बुक्के ना बुक्के दें. Shawl क्या कर रहा है? Shawl बुक्के नहीं कर पाएगा, पांची छोड़ दो. I hope no one is left now. Yeah. Okay. Thank you. I would like to. Sorry. Sir, the patient. Amma. Yeah, I'd like to give a special thanks and a mention for Sahachari Trust. Dr. Deepesh, he's the main member here. One more chair, please. If you can arrange one more chair. Mobile का chair किधर से? I'd like to mention a special thanks here for Sahachari Foundation. They have supported us for this facility, GBK Trust, and all the trust, Mr. Kotari, Trust Group, through Mr. Elton. Special thanks to Mr. Elton and Tia Manis for supporting Kamala Sundaram Foundation all along. There's a chair here. So you can. Chair kitne dena? So you can sit here, Mr. Kumar. There's a chair here. I hope everyone is comfortable now. I request Padma Shri Professor Dr. Natarajan to brief us on Blind Free India through Kamala Sundaram Foundation.
So at the outset, thank you all for coming, and I wrote in the morning in the group with my blessings of grandfather, grandparents, paternal, maternal, my father, mother, and with their blessings, and I thank Mata, Pita, Guru, Mitra and Deva. So Guru is Dr. Badrinath, Dr. Jovanovich, Dr. Abdul Kalam, and Mitra is Shivanandan, and that's what I learned from the movie Kuselan. So I keep learning, and as Swami Chinmayananda, I met him in 1977, he said always keep pushing the goal a goal post again, so that you have far-fetched hand to achieve something. So now nothing for me, because I'm happy. I'm reading Swami Vivekananda's yoga, all the 4 yogas by Swami Vivekananda. And he says, why are you working for name, fame, money? So I dedicate whatever I'm doing for the people, because Swami Vivekananda said, enough of working for name, fame, money, and I'm happy with what I have. If awards come, it will go to the staff. So I'm very happy that we are finally merged with our Shanmukha Trust, Shanmukhpriya Health Center, given by Subramania Swami Temple. And I mentioned in my CME that time, Subramaniam is my great-great-grandfather's name, and his son was Dr. S. Natarajan Pillai. He is my grandfather, who was an ophthalmologist, born in 1900. And his son was Natarajan Shanmukha Sundaram. Everybody is related to Shanmukhpriya, I don't know how, and Subramaniam Trust. And he was born in 1927 in Kulasekarapatnam. So I take the opportunity to welcome Shri K.L. Prasad, and I'm happy the entire police force is represented here. So instead of we have to give you bouquet, sir. You are giving. So thank you, sir. Thanks for coming. And I'm happy as though that Shivanandan is here through Prasad. So we just got Prasad from the Subramania Samaj temple. Thank you for coming. And we were all trained in the same hospital. So I'm 1930s. My grandfather was in the Government Eye Hospital, Madras, which was in Egmore. He lived in 10 Marshall's Road. In 1955, my father lived as a tutor. In 1957, I was born in Madurai, and I lived in the quarters from 1957 to 1969. So, right from the time I'm born, I'm breathing in and breathing out ophthalmology, and even today. So, with this, and with all the support from Sahachari Foundation, from the GBK Trust, my friends Nama Singh, Karan Singh, Kavita Singh, and they were really supportive, and through them I got Sahachari, and through Sahachari I got GBK. And with all this, sir, even though Elton is with me for long, but he now got this idea and made the idea himself. So, and thanks for the incredible team which is there from beginning, but he really polished them. So, Joseph, this message is for you and the 5 people who are there with me for long. Meenakshi is with me from 2011, and without you people, and as Shubha is called by Tom and Jerry, and I think I am Tom and Joseph is Jerry. So where is Shubha? Now Shubha is behind me. So for everything, for every successful boss, a great EA is behind me. So this I wrote a letter just a long time. Yesterday night onwards I couldn't sleep because Joseph sent me a love letter. So I wrote this thinking about Joseph. Dear incredible team, I am overwhelmed with gratitude as I think about the past 5 years of our charitable trust journey. Even though our trust was started in 2005 and we are doing charitable work from 1950s or so through various 3 generations and 125 years of man-hour, but the last 5 years is very crucial because post-COVID we had a tough time. Since COVID, your dedication to provide free eye care services in Mumbai slums has been a beacon of hope for thousands. Your selflessness, expertise, and compassion have not only restored vision but also transformed lives. So Meenakshi will tell that patients don't want to come because they want to look after their children or grandchildren, or they want to work, and we have to counsel them to come. And I am a fond follower of 2 great people whose statue is there in the Kanyakumari, where the 3 oceans meet: Bay of Bengal, Arabian Sea, and Indian Ocean. And that's where we have the Rock Memorial, where it's a Vivekananda Rock Memorial, and we have the famous poet Thiruvalluvar statue. And I went 2 months back to meditate there. And Swami Vivekananda meditated in 1893, and then he went to US through Chennai and then to Mumbai. So There, the statue of Tiruvallur is there, and school in Tamil Nadu, everybody has to read Tirukural, and I'm sure Dakshina will accept. So, as the great Tamil poet Tiruvallur said, the wealth of the giver is in proportion to the wealth he bestows upon others. This is Tirukural 2:11. Your generosity has enriched us all, and grateful to be part of this journey with you. And I'm thankful to the donors and the staff and people who have worked with me, and thank you all for tolerating all my idiosyncrasies. Swami Vivekananda's word resonates deeply with our mission. I'm glad this team who's here, who's working in Kamala Sundaram Eye Center, because I told they went to Sakwar every month, and the Swamiji is so kind, he feeds all of us. And I also took my team to do the trek where Shivaji Maharaj went there. I forgot the name of the hill, and it's full of rocks, and I fell down so many times while climbing. The Swamiji said, Swami Vivekananda said, you have to be strong. So if you want, climb that. It was looking very nice from outside, from the ashram, but it was tough. And the next 1 week I had to do massage daily. So he said, the best way to find yourself is to lose yourself in the surface of others. It is there in the Ramakrishna Mission website in Sakwar, and it's only for all doctors. You have to do treatment to the people. You should have a healthy people, a healthy brain, and that's where I remember my friend Shivanandan who's giving enriched food to the children. About 10,000 children, I'm a trustee there, we are feeding them. So unless you feed them well, they cannot think, and that's where Elton says you have to do exercise so that you have oxygen, water to the brain. And thanks to my mother for doing that, and that's why I'm full of energy. Your service has been a blessing to countless individuals, and I'm honored to work alongside each of you. As we look to the future, let's continue to strive for a blind-free India. Let's keep shining our light, spreading hope and restoring vision. Together we make a difference and bring about a brighter tomorrow for millions. And I'm happy we have Ganpati temple in Aditya Jyot, and we have a Subramania temple here, and for the father of them is Lord Natarajan. And I'm constantly in awe of your tireless efforts, late nights and endless patience. You have shown up with love, care and kindness, and I'm grateful for your unwavering commitment. 2 days back, I'm sure Elton has read that message from our CEO. He says, no more functions. This is the last function you are going to organize. I have agreed. He said he will organize in future, reorganize the Kamala Sundaram Foundation. Thank you for being the change makers, the hope bringers, and the light givers. So you will not get any more messages from me. Now Elton and Ravichandran will doing. Let's keep pushing boundaries, which I will push Ravi and Elton, and I know they will tolerate me. Innovating and serving with love. Together we can achieve the impossible and make India a beacon of hope for the world. And thanks to my friends Robert Redak, Ashraf Armia, and so many friends all over, they will all going to pour not only dollars, euros, but they will bring expertise. They will come and work here. So with all this, I have a sense of gratitude, and I want Anamika to give one by one. And I want to first to give, because Shubha is working tireless, so I'm going to give this envelope, which is filled with the check, she will fill it up. So Anamika, you have to give this to Shubha first. That's a check, empty check for you. So it's an empty check, she will fill the numbers. So she can fill the numbers, eh? You are the evidence there. Yeah. And then first is to, madam, you have to give it to Joseph.
Joseph.
And thank to Appa. There. So Joseph's story is, my father was friendly to him, and he was the, interpreter between me and my father, because my father did not know how to scold me, so he will scold me through him. And Sari Kannadar? Huh? Kidhar hai? Avana, yaar. Shubha, you be there, na? Shubha.
Sir is coming.
Shubha here,
Do
na?
some work.
No, Shubha, you come here, na? Come there. Take, madam. Oh, sorry. You be there, yeah. Because it is long pending. Post-COVID, we were totally bankrupt in the foundation. But thanks to a lot of donors and including my family to support them. Vaishali Kamble. And thanks to Shubha and Ravi and Elton who are collecting the money, calculating, and they are after me to give because I was always worried what to do for money, but money is coming. And Madhuri Arjun. But these are people working with me for last 5 years. Pradeep Kavale. And I want to tell a story about Pradeep. Pradeep worked with my friend and chartered accountant Ganesh Shanbag. Oh, sorry. And he is not studied, but he is maintaining the accounts perfectly. Thanks to PKF for now doing our auditing. And last not but the least, I want Meenakshi. Meenakshi किधर है? Meenakshi, Abhi, you come here, na? Tell in Marathi, on behalf of the 5 people, she has to give a bhashan.
She has to deliver.
Bhashan.
मीनाक्षी ते इथे आपल्या फाउंडेशनबद्दल आणि तुमचं चौघांबद्दल
About this.
अबाउट
On behalf of all the 5, she has to give a response.
एक थँक्स गिविंग सारखं मराठीमध्ये असं काहीतरी वॉट एव्हर यू वॉन्ट टू से काय बोलायचं ते बोल नाही तर चेक मिळणार नाही.
No, she is with me from 2011 and I am born in Madurai. Even though I scold her, I remember Meenakshi Amman, who is the ruling deity of Madurai. And that's why in Tamil Nadu, all the people Shanmukhpriya sitting here are called from Madurai. You know why? The women dominate in Madurai. That the wives dominate the husband. There Meenakshi Amman dominates Sundareshwar. And nobody knows the Lord Shiva's name there. And that's why my name is Chidambaram. That's why I'm alone. You, Elton.
मराठीमध्ये बोलतो. सर्वांना माझा नमस्कार. मी कमला सुंदरम फाउंडेशनला पहिल्यांदा मी सगळ्यांना थँक्स बोलते आणि मी प्रोफेसर नटराजन सरांबरोबर 2011 पासून काम करते. तर मला खूप आनंद होतो की त्यांच्याबरोबर काम करताना खूप नवीन नवीन मला शिकायला मिळालं या फाउंडेशनमध्ये. आणि थँक्स फॉर इट चेक. आणि असंच मला म्हणजे खूप उत्साह आहे या फाउंडेशनमध्ये काम करण्यासाठी आणि अजून मी चांगल्या प्रकारे काम करणार मी माझ्या टीमला घेऊन. तर तुमचा फक्त मला आशीर्वाद पाहिजे आणि सहकार्य पाहिजे आणि सपोर्ट पाहिजे सर. थँक्यू.
Thank you. I'll do a little job of Shubha. So I want Meenakshi, bring 3 bouquets. I want to give one to our advocate Mahesh Kotian, who is our legal advisor, and he has told me that he will not, if I talk about fees, he will not work for me. So he is our legal advisor for Kamala Sundaram Foundation. And please come, sir. Kalyan Sundaram, sir. So me and Mahesh Kotian go to Tirupati every year on February 10th, but now post-COVID we are not able to join him, and we do a whole day puja. Thank you, sir, for coming. And now I request one more bouquet for my friend, our KL Prasad, sir. Where's the bouquet? Madam, Anamika, you can give that. Anamika Chawhan madam to give a bouquet to him. Hey, where is that bouquet? Yeah. Thank you, sir. And I request Prasad sir to say a few words. Come, sir. And actually, he and Venkatesham sir had attended my 2004 function, and that time all the 5 hospitals, including Dr. Venkateswamy, the founder of Arvind, Dr. Badrinath, Dr. Tiwari from All India Institute, Mullapalli Rao from L.V. Prasad, Chief Minister Sushil Kumar Shinde, and Aishwarya Rai was there. But mainly Shivanandan, Dr. Venkatesham and K.L. Prasad was there. And sir is there with me for all the time. And his famous statement, I don't want to tell here, who everybody knows in Mumbai.
Dr. Anamika Madam, Dr. Natarajan, and ladies and gentlemen. नटराजन साहब के बारे में बोलने का है तो बहुत कुछ है. वो कहाँ है? वो येवूर हिल्स में जाता था. टाइगर्स उधर से भाग जाता था बिकॉज इसका आवाज़ और हंसना सुन के. ये जोक था येवूर हिल्स में. और वो कहीं भी हैं नटराजन साहब, हंसता है, हंसाता है, और एनर्जी लोगों को देने में वो नंबर 1 है. और कभी कभी ऐसी लगता है वो भी हमारा उम्र का है, बट दुनिया में कोई भी यूनिवर्सिटी नहीं है, कोई भी कंट्री नहीं है, वो नहीं जाता. अभी भी 20-25 दिन वो बाहर ही रहता है. मैं उनको पूछता है, भाई हम कभी एक बार अमेरिका गया तो 2 दिन हमको जेट लैग हो जाता है, अब कैसे चलते रहता है. एंड यू नो फेमस आइस, एक बार उनका फंक्शन हुआ, उधर पहली बार मेरे को पता चला ये ऐश्वर्या राय की आँख भी देखता है. ओके, सो नटराजन साहब हमारा फैमिली जैसे है, ब्रदर जैसे है, हर एक चीज़ में हम लोग हैं. ऑफकोर्स शिवानंदन इज़ द एल्डर ब्रदर, बीच में वो है, बात में मैं है. और आज ही नहीं है, मेरे को मालूम है धारावी में भी है, गढ़चिरौली में भी है, सब जगह सोशल वर्क करते गया. हज़ारों लोगों को, आज लाखों लोग हो गया होंगे, उनका नेत्रदान करने में और कैटरैक्ट ऑपरेशंस करने में ये सब कुछ करता है. और ये कमला सुंदरम फाउंडेशन द्वारा गरीब लोगों को मदद करने के लिए रोपण किया, और एक माइलस्टोन है आपका लाइफ में. और हार्टी कंग्रेचुलेशंस. मे दिस फाउंडेशन रन फॉर एवर and do service to the people. Jai Hind, Jai Maharashtra.
With the permission of Prasad sir, my daughter was supposed to come, but I have a better daughter. I want to give this bouquet to Tia. Come. And Tia is the honorary media and what is that? Chief Marketing for Kamala Sundaram Foundation and Sundaram Natarajan Foundation. And we wish her all the best who have joined us for a few weeks now. And really all the creative work, everything she's doing for us, whatever you see is created by Tia. And we all thank Elton for producing her.
Thank you, Dr. Natarajan sir and Mr. Prasad sir, for the warm and insightful sites. To better understand the context of today's CME, and the pioneering work being done in our community, I would like to invite Dr. Avik Sarkar to share insights about this facility clinic at Chembur and its commitment to advancing ophthalmic care through technology. I would request any of this Srishti or Meenakshi to give a bouquet to him, please. He is the doctor in charge of this facility.
Good afternoon, everyone. I'm Dr. Avik Sarkar. I'll be heading this clinic from now onwards. I have recently joined over here. This Kamala Sundaram Eye Center is mainly for the unprivileged to the poorest of the society, to whom till date medical facilities is something unapproachable. It's not possible for them always to come hospital. So I have been trained in Arvind Madurai. Over there we have learned to those people who cannot come to you, you have to reach to them. So we have our very own social workers. They are excellent. They are working tirelessly to get all the patients over here. They are going each and every home in nearby vicinity so that the patients can come over this place and get the facilities over here. This place is equipped with OPD and the OT setup. The OT is is competent with both cataract surgeries and retina surgeries. We have in our OPD setup all our best in the market equipments. We are already launching in this already. Just now we are in the CME. We have showed already that we have our 3D machine. It's already in our and mostly we'll be showing one live surgery today. If everything goes good, we'll be showing a live surgery today on vitreoretinal surgery on that particular 3D machine. We have other machines also, so that we can serve the people with the best of the technologies. And in the OPD setup also we have the slit lamps and the retinal lasers, all the kind of surgeries or all the kinds of facilities that can be provided in a top-notch institute. We are good to go with all those kind of treatments. So I really want you all to wish us luck. Hope we'll do very well and we'll go ahead further. Thank you.
Thank you, Dr. Avik Day, for providing an excellent overview. It's inspiring to see how institutions like Kamala Sundaram Foundation is embracing technology advancement to enhance patient outreach and treatment. Subramaniam Samaj facility Shanmukhpriya Healthcare has given their beautiful facility to Kamala Sundaram Eye Center for running this ophthalmic clinic at Chembur. They are instrumental in bringing together today's program. Their commitment to supporting advancing healthcare deserves recognition. Let us hear from the trustee, Mr. Kalyana Sundaram from Subramaniam Samaj, about their vision for the future of ophthalmic care.
First of all, Dr. Natarajan, thanks for the invite for me as well as for the other trustees of Subramaniam Samaj and Shanmukhpriya. As a background, Subramaniam Samaj was started in 1945. So about a couple of years back, we celebrated our 80 years. And in 1995, we set up Shanmukhpriya Charity Trust with the object of providing facilities for education, healthcare, and cultural. It was a desire, vision of the trustees at that time that not only to do education in the form of institutions, but also want to set up a medical facilities. Now the division was going on for some time. It culminated in 2022 when we performed the Kumbhabhishek for the temple. We also launched a multi-speciality daycare center that we should do that, and we acquired this place. And then we started the procedure for doing all the things interior. And initially what we did, even though that is going on now, is that we have a 10-bed dialysis center and we're working in 3 shifts. And though it is not free, we are doing it at a very subsidized rate. Not that we do not want to do free, but we are creating a corpus. There are companies like Kotak Foundation and other services are doing that. So with that, I think we are hopeful that in the near future we will be able to provide that facilities also. As we were progressing, it happened that Dr. Natarajan, he says he is from Chidambaram, but he is not from Chidambaram, he is from Mumbai. From Vadala he came to Chembur and founded my colleague Mr. Subramaniam, and he said, why, this is a beautiful center, why not we set a facility? So that is where the relationship started and the relationship continues. And whatever facilities we have here, he had a look at it, the operation theatre we created, the OPD is here, all put together, he had something like a great inspiration that we had to do something here. And for him, as he rightly said, Prasad rightly said, that he is here today, tomorrow he is in Delhi, day after Egypt, he is going to Greece. When I asked him about that, next month I am going to Greece. So to catch hold of him and see that we start the procedure itself, it takes time. But anyhow, I think the best thing is that, and he said, Madurai, I can tell you, he is around him all ladies only. Right? But, so he is Natarajan, that is why he is called Natarajan. Right? But I think the best thing is that he has started it now, and things are doing very well, and we hope that, we will be able to do. And actually speaking, Shanmukhpriya Charity Trust really privileged to be associated with Dr. Natarajan and make this center as a great center for this. He was telling about the school. Now the school is a different entity by itself, but I have requested him to give talk on eye care to the students, which again he said he will be able to do only in the month of August because he is going abroad, right, for that. But I think he is, as he rightly said, his energy has no limitation, right? This morning he is there, this afternoon we do not know where he will be, right? That is the kind of energy, but I think he is a very well-known person. I know him from Shanmukhpriya days, this. So I think he is a very energetic person, and whatever best we can do for the success of that Kamala Sundaram Foundation, we will jointly do that, and I always wish him on behalf of my colleagues here, all the very best, and let's do it. As he has got a word called, let's do it. So I am just telling, let us do it and take it forward. Thank you.
Thank you, sir, for sharing the vision of the trustees. I request Mr. Elton to come and share a few words. How do I introduce you? What do I introduce you?
Good afternoon, everybody. I'm very grateful to be standing here today with Dr. Natarajan and sharing his dream of blind-free India. I am extremely grateful for Shanmukhpriya. Kamala Sundaram Foundation has found a lovely home here. And with Shivnandan sir, I have known Dr. Natarajan for the last 30 years. And all of a sudden, I was at his 125-year celebration at Sion Hospital, where I suddenly decided to be part of his journey. God's been kind. He's been assisting us. We have collected a good amount of money to get this unit started, which was told in, I think, from Jan onwards. And we've got it running. And hopefully on the 30th, with the governor of Maharashtra, we are inaugurating our second unit which is going to be our headquarters in Dharavi. And Chennai happening very soon. With Doctor, as you said, he keeps traveling around the world. All of a sudden, we are about to announce in the next half an hour our institution, which hopefully with Rajni ma'am should be on the 11th floor. So I thank all of you all for coming today, and I thank all of you all. Have a lovely day. Cheers.
Thank you, Mr. Elton. We now come to key highlight of today's program. Dr. Anamika Chawhan, whose work in advanced ophthalmic technologies has garnered significant recognition, will share her insight on SeeLuma's innovative digital and 3D technology microsurgery from Bausch and Lomb. Dr. Anamika Chawhan is a life coach, counselor, professor. She has transformed many lives. I invite her on stage to give a talk.
Good afternoon, everybody. It's such a lovely place to be at right now. And I want you all to take just 2 minutes of your quiet time and bless this place. Because whenever we bless the place and we bless the mission, it magnifies and also it becomes super easy for people to come in, because we all are working in a frequency like a magnet. Do you all agree with me? Yeah? So let's just take 2 minutes of your time. Keep your tongue touching to the roof of your mouth. Yes, this way you are touching to your pineal gland. Keep your eyes closed. Think of Dr. Natarajan and this wonderful place. And please bless him. Bless Shanmukhpriya Health Care Center, Kamala Sundaram Foundation. And imagine that like a magnet, it is attracting all the right people to come here and take the service of this beautiful mission of making India blind free. People are just scrolling from each and every place through word of mouth. This place is filled with every person who needs this facility. And please also bless all our healthcare professionals, eye surgeons, doctors who will be assisting them. And imagine there is a shower of flowers on all of us. Thank you so much. So this is what I do. I'm Dr. Anamika Chawhan. I'm a cognitive scientist from IIT Bombay. Apart from doing meditations, hypnotherapy, psychotherapy, I have not done much work around eye, but I also do a lot of work with vision. Vision of a person, vision of purpose, vision of how and where the person wants to be at. And my association with Dr. Natarajan, thank you so much, sir, for inviting me. It's really an honor again. And our association goes back from 2019, where I used to conduct my Magnificent Morning program at 5:30 a.m. live. And more than 300, 400 people used to attend that. And it was really an honor. Dr. Natarajan also used to attend that session. And not just once, but numerous of times. Our association goes long back to me coming and taking sessions for my lovely girl. So me and Shubha also go really long well, and we have also done many sessions at the Aditya Jyot Hospital, and it's really wonderful because when it comes to increasing the vision, a person who doesn't have a clear vision, they feel really sad and also have a lot of doubt and trust issues. By just giving them this awareness that now it is super easy, they don't even have to splurge so much of money, and we have a facility like this in the heart of Bombay, is really a blessing, and none other than we should thank Dr. Sundaram. Thank you, sir. Thank you, thank you, sir. Thank you, sir.
Thank you, Dr. Anamika Chawhan. As we conclude today's enlightening session, I would like to invite Mr. Sandeep Giri, who is the project manager of Kamala Sundaram Foundation. He will acknowledge all those who made today's program possible.
Good afternoon to one and all present here. As we come to the close of today's event, a day that has been as enriching as it has been inspiring, it is my privilege and heartfelt duty to extend a vote of thanks on behalf of Kamala Sundaram Foundation. Today has been more than just a scientific gathering or a ceremonial opening. It has been a celebration of vision, both literal and metaphorical, a reaffirmation of our long-standing commitment to eliminating preventable blindness, and a moment of pride as we inaugurate our new Chembur Eye Care Center under the Foundation expanding footprint. Let me begin by thanking our eminent speakers and guests who brought depth and diversity to today's CME session. Dr. Avik, your talk on 2D life aiming for a 3D future was a brilliant narrative of purpose-driven transformation and a testament to your journey with Aravind and Kamala Sundaram Foundation. Dr. S. Natarajan, your presentation on 3D SeeLuma experience reminded us how far technology has come in enabling better outcomes and restoring sight with precision and empathy. Dr. Shruti from Sion Hospital Thank you for bringing systems thinking and community care into the fold, a perspective that aligns deeply with our mission. And to all our moderators, discussants, and attendees, your engagement elevated every session. Thank you for making the CME platform not only a knowledge sharing but a collaborative thinking. We also extend our warmest thanks to the supporting staff, volunteers, and organizing team whose behind the scenes effort ensured that every element from the clinical tour to the hospitality ran smoothly and professionally. A special note of thanks to our dignitaries and well-wishers who have joined us for the inauguration from the Shanmukhpriya Eye Care Center. This center is not just a beginning, it's a symbol of our evolving legacy. I thank our major supporters, Sachari Foundation and GBK Charitable Trust, who have supported us through initiatives like Light of Hope. We aim to bring affordable and advanced retinal care to the economically underserved, making our mission more accessible and inclusive than ever before. Special thanks to our well-wisher Mr. Elton and Thea, our partners, collaborators, and long-standing supporters. Thank you for believing in our vision and walking this journey with us, from our humble beginning as Aditya Jyot Foundation to the transformation of Kamala Sundaram Foundation we are today. Above all, thank you to each one of you, especially from Shanmukhpriya staff members, Dr. Dipesh, not just as a guest or delegates, as a stakeholder in our greater cause. Also my KSF team members headed by our managing trustee, Professor Natarajan. As we move ahead from this day, we may carry the learnings, the conversation, and the collective energy forward to build a healthier, brighter, and a blind-free India. One patient, one community at a time. Thank you once again for being here.
Thank you, Mr. Sandeep. Ladies and gentlemen, as we conclude this remarkable inaugural CME session on SeeLuma's innovative digital and 3D technology microsurgery by Bausch and Lomb, I hope you leave here inspired by the possibilities. Where is the page? That lie ahead in our field. The future of ophthalmology is being written today through innovations like those we have discussed, and each of you play a crucial role in that story. Before we part ways, all guests are cordially invited to join us for lunch. Please make your way to the dining area where you can continue today's conversations and building new professional connections. Post lunch, we can have an open house wherein all the guests are invited to go around and take a look at our facility. We request each one of you to spread a word among your families, colleagues, friends about this facility. Thank you for your attention, your participation, and your commitment to the excellence in patient care. Have a wonderful afternoon. Thank you, ma'am.
And special thanks to Shubha. So we'll have a group photograph with Shubha Joseph. And other one is what Joseph manager has done. We have kept a ribbon. So before the lunch, Anamika madam and our Kamala Sundaram sir and all trustees, only few of us will go cut the ribbon symbolically, which we already inaugurated, and then we can have lunch and also see the facility. And special thanks to Dr. Jaydeep, who has come all the way. He is a part of Aditya Jyot and me from Shankara Netralaya with me from 2007.